Ready to go? Good. Ladies and gentlemen, official welcome to the day of Solutions Before Tea. The first Roy addressed us yesterday.
Sort of more veterinary side on focus areas and opportunities, and then we'll talk a little bit, because this was kind of something I didn't really expect, was there was a little bit of pushback on the term VP of veterinary paraprofessional, and so it's, yeah, we'll talk a little bit about that briefly, and then considerations and roles for veterinary paraprofessionals as well as other health professionals, and then additional comments and some concluding thoughts. So any journey, of course, is a lot more fun with friends and colleagues, and so I actually recruited, as I mentioned, a number of colleagues, and actually a lot of these are pretty good friends from all over the world and the US. So, including Jill, who got me her thoughts as well. So my questions for all of my colleagues, after Jill and I kind of went back and forth about what talk I should give, was number one, what's your current title and your described primary role? I figure this gives everyone kind of an idea, at least what people are doing already, a little bit of breadth. What are underserved and emerging areas in aquatic animal medicine? Do you work with colleagues you consider VPPs? And this is, like I said, I got a kind of interesting comments for that term. And then where is more or different roles for VPPs and others in aquatic animal medicine? Where could those be needed? So for the vet side, there's a million ways you can divide that up. I divided it into fisheries and natural resources, aquaculture, aquaria and zoos, pet fish, regulatory and public health, lab animal, and then academia / research. So obviously there's a lot of overlap, and with the people that I had gotten in touch with, they have a lot of overlap as well with what they actually do. I've categorized them kind of from what they did in a major sort of sense. So you guys will meet Nora and Guppy, and then aquaculture, Paul from Australia, Jill, of course, you guys know, Matt from the UK, and Hugh Mitchell, who was Canadian / US. We pretend he's from the US. And then from Australia, Rob Jones, Rolando, a friend from Guatemala, Darren Doherty from the UK, and Jesse Sanders from the US. Meow was actually a former student, but she's in Thailand now. She's from Thailand. Kathleen and Johnny from the US. On the lab animal side, it was actually in a lot of these, it's kind of scary, but a lot of these were students. So Mike Palillo, Erica Feldman, and Don Rothen, all with lab animal, are all from the US. And then Pedro, who's from Brazil and is a vet from Brazil, but is in the US right now. Myron Kebis, many of you probably know. Carla Savage, Carla Phillips from Trinidad and Tobago, and then Hytham from Egypt. So Nora is a program vet for the Northwest Indian Fisheries Commission, and she actually does vet services for stock enhancement for Pacific salmon. Guppy Blair, interestingly, I had when she was in touch with me, she mentioned that she had done an externship with the Northwest Indian Fisheries Commission a long time ago before they had vets, because she's about my age, and so currently she's the branch chief for the U.S. Fish and Wildlife Service ADAP program, and they're involved with trying to get and facilitate drug approvals for aquaculture and fisheries. So kind of what they thought maybe were gaps, and again, I told them it doesn't have to be within their area, but if it, if they could, that's great. So Nora was thinking definitely since she's there, she does see a lot of need, and there's a lot of potential opportunities in the U.S. I assume possibly elsewhere in public sector type aquaculture, conservation and stock enhancement. This is a picture from Boat Marine Lab. I work with those folks on common snook. And then Guppy mentioned marine aquaculture, and this is another group I worked with in the late 1990s, early 2000s, and continues to with vaccine work. He worked with the salmonid industry to start with, and then did a lot of vaccine work throughout his career, and he does a lot of consulting for places as well. And then Matt, who is in the UK, is owner and managing director of the Aquatic Vets, which is another consultant type firm for aquaculture and public aquaria. So where they thought there might be good uses, and actually it was interesting, some of them gave me kind of more thematic or more sort of research type questions. So gill health, a couple of folks actually said gill health. We talk about gills, we do gill clips, all that sort of thing, but really the interaction between gill and the water quality and all the different kind of fine points about gills, we probably don't have a very good understanding. He also mentioned nutrition, species-specific nutrition. That's a clown loach. We had folks that were breeding clown loaches. You can see the two juveniles underneath were deformed, so there were some nutritional issues there. Jill mentioned definitely in South Africa, there's a lot of opportunities just in all areas of aquatics, and she's been obviously working really hard on filling those gaps with people and education. Hugh, which is something actually a lot of us had talked about in aquaculture, there's really not many commonly or really good performance tools, computer programs that will help with production indices. I think there are some available out there. I've seen some at WASP, but I really haven't worked too well with them, and I'm not familiar with how good they are. And then there's discussion from Matt about people being more kind of specified or specific in their type of species they work with. He sees that a little bit more, kind of like happened with domestic animals, but also other species, like he did mention coral as another area. So for zoos and aquaria zoo pet fish, I put these together. Rolando is a private practitioner who worked with some public aquaria in Guatemala. Jessie Sanders is a private practice owner, Aquatic Vet Services. She's very good with PR and a great vet as well. But she does a lot of work with primarily ornamental and pond clientele, but some aquaculture. Rob Jones is, some of you may know him really well. He's done a lot of work online as well for education of aquarists and vets, but he's the founder of the Aquarium Vet, which is a big consultant firm that works with a lot of Asian and other areas, other aquaria all over. And then Darren Doherty, who has done a lot of work with salmonids and pet fish. He said, just say, private practice, and he does basically aquatic, exotic, and wildlife vet medicine from the UK. So in terms of kind of needs and opportunities, Rolando made a point of saying that he thought the academic and practical prep in Guatemala was really pretty bad for fish vets as well as for aquaculture. So he saw a lot of kind of just need in terms of education from that viewpoint. One thing that Jesse mentioned, and we've talked about this quite a bit, is there's really not a lot of, and we're still working on trying to educate the stakeholders in terms of why vets are important. This has kind of been a problem or a challenge for the last 10, 20, 30 years anyway, but still, it remains to be. Rob mentioned, hope you guys like the kangaroo with the fish in it, that there's a shortage of vets that see pet fish in Australia. And then Darren, again, mentioned gill health and the microbiome is something really important. And then also, he was looking at amoebic gill disease in Scottish salmon as being a major problem right now. So regulatory public health, Meow is a vet officer, and she's head of this drug and chemical research development subdivision in the Department of Fisheries there. She does kind of a combination of research and outreach. She does surveillance for antimicrobial use and resistance. She trains officers for fish health and farms as well. Disease diagnostics and does health certification. So she's kind of a jack of all trades, or Jill of all trades, sorry. And then Kathleen is our USDA APHIS vet med officer, who's a senior staff vet for aquaculture health. And one thing, she does a lot of policy now. One thing I do want to mention, she and a number of other folks, but she was one of the leads with our National Aquaculture Health Plan and Standards and the CAPS program that we're trying to implement in the U.S. And then Johnny, another good friend, and actually was a former student and really great veterinarian. He currently now, he's done a lot of different things, working in vet at a private aquaculture farm, and then USDA, and now he works with NOAA NIMS, which is our in charge of seafood inspection, and he's got a lot of different roles. So he's a lot of regulatory compliance, guidance, export evaluation. He's a technical expert for a lot of these issues, and again, he's kind of another person that does a lot of different things for on the regulatory side. So these saw opportunities kind of in a different mix. Clinical for Meow in Thailand, she said clinical pharmacology and definitely aquaculture vets over there. They have a need. Kathleen and Johnny were kind of similar, aquaculture in general, both education on aquaculture and aquaculture systems for veterinarians. A lot of them still aren't really quite familiar with that, and then aquaculture vets in general as well. On the lab animal side, Erica Feldman is assistant director and long title at Cornell. So she does a lot of, as what you would imagine a person in lab animal would do. She oversees programs, works with mentoring students and residents, in charge of all the animal kind of health and welfare issues, et cetera. Mike Palullo is a second-year lab animal resident at working at Sloan Kettering, Cornell, Rockefeller in New York City. And he has kind of somewhat similar, but obviously not as high up as Erica's, but still oversees biosecurity, medicine, welfare, et cetera. And then Dan Rothen is a research assistant professor, but he's a lab animal vet at the University of Miami. And one kind of cool thing with Dan is that he does a lot of lab animal vet. He's officially in the Department of Surgery, as it says there, but he also works, University of Miami has a mariculture research center, so he's the vet for all of their coral, all of their fish, et cetera, as well. So in terms of needs, a lot of things about the lack of understanding of aquaculture aquatic systems for a lot of the lab animal community, which I think we kind of know, and so they and a lot of others are trying to work to make sure that, and a lot of it is even the researchers who are working with fish. Many of you may probably realize, they don't know anything about keeping fish, so there's a lot of need there. And then also opportunities, Dan said, just in terms of import-export duties, so a lot of things to consider. Academia research, this is Carla Phillips, and she was faculty at, she might still be adjunct, but she was faculty at the University of West Indies. She just moved and took a job at Virginia Tech now, but she was involved now at Tech with teaching and educational outreach, career advisement for more corporate type veterinary medicine. Myron, who I've known forever, was actually a private vet that worked 6 different states in the U.S. as a mobile vet practice, became the state culture director for Wisconsin, and now he took a position doing outreach at Michigan State. So he knows quite a bit. And he's involved with, at his current position, a lot of disease control, student training, and vet training, vaccine development, and research. Haitham from Egypt is associate professor at the Aswat University in fish disease and management. And he said he teaches a lot of fish medicine to students at 2 universities. He mentioned that one university is about 10 hours, I think, by bus. And he said there's a big need for education over there in fish and aquaculture. And then Pedro was a vet in Brazil, but he's a postdoc now at UF. And he does a lot more kind of lab bench type work, but he also helps with diagnostics with cases as well and genomics. So in terms of opportunities, there's, again, kind of a mix here. On the Caribbean side, just all areas, Carla Felt, aquatic inverts, coral. On the fish farm side, or on aquaculture side, Myron still feels there's a big need, and there is definitely for aquaculture and public hatchery medicine. For Haitham in Egypt, he said a lot of need in other areas as well of aquatics, and I kind of focus on aquatic fish and, fish and aquatic inverts. Hopefully fish are aquatic. And in Brazil, Pedro mentioned that a lot of the states in Brazil don't really have aquatic vets. There are some that may have a higher concentration of aquaculture that do have veterinarians, but there's quite a need still. So now I want to talk a little bit about the veterinary paraprofessional, because this was really kind of something I didn't quite expect. I sent out that question about people working with veterinary paraprofessionals or paravets, and a lot of not all of them, but a lot of similar type feeling, like some people feel that would be really offended. That people would be offended if they were called a paraprofessional. I think these terms are inappropriate for those I work with who are really knowledgeable, but they're not, they're not vets. Haven't heard that term before. I actually saw that quite a bit. Obviously these are people that maybe don't work with OIE or WA or WOAH. And then in Egypt, Hytham said, as kind of part of this, because again, paravet, that there are folks that will basically work in a vet clinic, and he said they could be from high school or any age. After a couple months or a year, then they'll open up their own shop. So so you can see why there's a little bit of hesitation when we talk about paravets in different areas of the country. So I've got this definition here. We're going to break it down, and essentially a lot of this I took from Roland Kobold, who had actually a really great talk, which I didn't want to cut and paste completely, so I just took some of the highlights of his talk that he gave, I think, for OIE. So basically the main points here are that they're going to be authorized by a vet statutory body. The official term, veterinary paraprofessional, under the responsibility of a vet. And then we know what a vet means and veterinary statutory body, but those were defined as well. So I think that's kind of a little bit of a confusion for people, and I would say in the US, because we do have people that don't work under a vet, but they have aquatic animal health duties. And I wouldn't expect them to work under a vet for what they do. Just again, a little more context here. And this is again from Dr. Kobold, who said in the definitions by WOA and OIE, the big thing with veterinary authority is that it's a team approach, so it actually is comprised in the definition of vets, other professionals and paraprofessionals. Competent authority, again, it's vet authority or other governmental authority, so it's not really vet specific necessarily, and then official vet is authorized to do things that are not necessarily in practice acts for those countries. So bottom line, the definition and context, VPP or not VP, that's the question. So I think, like I said, I think there's confusion on what people refer to when they say that. So I think veterinary nurse, veterinary tech, veterinary assistant, we kind of see those as more veterinary paraprofessionals, and I think for a lot of needs we'll talk about, that makes a lot of sense to have those in certain parts of the country or different regions. There are a lot of folks we work with that have animal health in their title, but they may not be necessarily veterinary paraprofessionals. And then, of course, community animal health workers, which will, be important in a lot of different types of countries. So again, knowing the difference between those two, I think, is important. Defining those, it's going to vary, as I said. Also, are they semi-autonomous or autonomous legally? I know people worried about them doing something that's not within their scope and legal practice, and then public versus private is always going to be a little bit different as well. So considerations for roles. This was the best I could do for like a role picture, so I put this fish on stage. So considerations, these are some lessons from foot and mouth disease that was mentioned yesterday. So they had looked at VPPs and how they can assist with those outbreaks of FMD that are occurring. So number one was defining and differentiating VPPs from other, well, I kind of added that part, from other professionals. It will vary by local, country, region, depending on what the needs are, et cetera. Determine and address the legal and regulatory issues is really important. And then one thing that was kind of mentioned, I think, which makes a lot of sense, and we probably want to work, we are trying to work there, but is establishing cultural and complementary relationships between the veterinary paraprofessionals, and other aquatic health professionals, and veterinarians. And I think sort of figuring out where everybody fits in, so that people understand is really important. And we have a lot of challenges, but it's getting a lot better, at least in the U.S., I think, to a degree. Establishing standards and competency checks for veterinary paraprofessionals, and then, of course, developing and providing training in CE. So needs, again, true VPPs are needed in a lot of areas, especially rural areas that don't have vet support. We talked about the legalities involved, and obviously making sure that the people that are doing those, taking those roles on, have the right knowledge and experience to do it properly, because just because there's a need doesn't mean anybody should be doing it. Fisheries and natural resources, again, a lot of different areas where someone who's interested in health can work, assistants and biologists for sampling, case follow-up, lab or water quality tests, and a lot of these actually were comments from the folks that I had surveyed. Treatments, and then fish disease diagnosticians, fish health point persons for daily operations of stock enhancement facilities. In aquaculture, again, similar fish health officers or managers for daily ops and to work with the vet with regard to treatments. Well-trained extension officers, again, whether it's in Africa or Thailand, that are serving as basically veterinary paraprofessionals to provide baseline rural support, and then hopefully working with vets at some level. I think this might have been Jill saying there could be challenges again with basic equipment, funding, and oversight for those folks. So that's obviously finance is always going to be a big issue, as well as just as manpower, of course. Technicians, vet technicians to help with diagnostics, and then one thing veterinarians from other countries who may not be able to pass local boards but do have a lot of knowledge, are going to be important as well. Pet fish, again, same thing. If there's no support. Vet support, then vet nurses may be definitely needed, and at least one of the folks in the UK had mentioned that some parts of the UK don't have a lot of good aquatic vets. And then lab animal research, we talked about just making sure the husbandry staff is really knowledgeable in general about general health practices, and as well as actually the researchers and the postdocs, et cetera, that are doing the work. Because a lot of times, and I've even seen that, not that I'm working directly with the lab animal folks, but that they don't know anything about keeping fish, and some of you may probably see that as well. So helping with just the management, husbandry, any health evaluation, sample collection. One of the folks, I think that was Mike Palillo, said it would be nice to actually have biosecurity specialists at the lab animal facilities who are really going to be going around and be a lot more critical. Lab and pathology diagnosticians, and then in academia, kind of similar, lab managers for research labs, biologists and husbandry staff that know health management, that are keeping the fish healthy for research, outreach, teaching, and research support as well. So additional comments. Again, some of these we talked about, so a little bit of reiteration. More licensed aquatic vets are needed in general all over the place, and there are concerns, as I mentioned, Haitham from Egypt, about people who, if there's not a lot of regulation in the country, that are going to say they're knowledgeable, but bottom line is they're not doing a service to their clients or stakeholders, and obviously it doesn't look good for our profession as well. U.S. aquatic vets, we are still relatively new, even though we've been kind of around, but there's still a lot of questions about whether that we're underutilized, underappreciated, and a little bit of a challenge with fisheries biologists in the U.S. that have been working with fish health for decades longer than we have. So there's a little bit of that. Significant difference in vet trained approach versus other health professionals. That's something that we do see. Now we do have a lot of colleagues that really understand to the level that I feel that vets understand health management and that, but that is an issue with some of those fisheries people. Clearly defined roles and standards for these other groups that are not veterinarians. Incentives for team approaches to try to make vets and other health professionals work a little bit more. Again, it goes to that culture of understanding how we complement each other. And I'm almost done. And then more integration of aquaculture and companion animal vet knowledge base into lab animals. So there's still kind of that gap between what we're doing in other fields and what's happening in lab animal with regard to management. And then one thing which was kind of mentioned too, just water quality and treatment options and their impacts on research. So it's always an issue, like if someone is going to be using a drug because the zebrafish are having some sort of diseases, or how does that affect their research, or how do different parasites like some of the pseudoloma, which is a nervous system parasite, how does that affect zebrafish research? A lot of those questions. And then, aquatic invert medicine, as we mentioned, that's sort of another area that we really need a lot more work in. There's some work on bivalves, on the bivalve side, but there's a lot of other areas that need more work as well as that. So concluding thoughts, aquatic invert medicine continues to expand and is still new in a lot of different ways. In other ways, it's not, but we still have a lot to go. A lot more opportunities, because there are kind of a lot of different areas. When I started, working in '92. There definitely weren't quite as many, and I know probably for Nick as well, who, there were, and Julie, that's right, you guys you're older than me, I keep forgetting. Yeah, they're really old too. So, yeah, even opportunities then were even a lot less, back in the 1830s, I guess. And so, I'm just kidding. So, there's a lot more, and there's going to be a lot more opportunities for the veterinary paraprofessionals and other fish health or other health professionals as well. Needs and access to competent vets will vary, as we talked about, and I tried to give you some examples of that. Many of you may be aware of some of those, but I wasn't definitely aware of some of them. And then the legalities is important, as well as actually whether there's going to be any type of repercussions for folks that are not working legally, which apparently is a challenge in some of the countries. So, and then again, defined roles, obviously appropriate training. If they're doing the work, they need to understand and do it properly to do the best for their clients. Regulatory oversight, again, for professionals. And then, so defining roles, having good training and regulatory oversight, and then understanding roles for those who aren't veterinary paraprofessionals, who are work separately but are still very complementary to our field, and making sure that we can promote goodwill and team approaches to health management. And that was it. Well, you all stayed awake, so thank you. Actually, even Julius, so yeah. So, all right, thanks everybody. But yeah, I know it was really, yep, Stephen. Oh, sir. Yeah, for the online, yeah.
I can't let Roy get off the stage that easy. Roy, great presentation. I'm curious if you could maybe share your thoughts. You talked a lot about opportunities for veterinarians. What do you see as the biggest impediment of veterinarians increasing their scope of influence in aquatic animal health?
Increasing their scope of influence? Well, I think one of the things, at least in the U.S., we saw was it did take a while for our big body, the American Veterinary Medical Association, to kind of embrace aquatics, and now they have really well, so we're happy about that. But early on, it took a while, and I think even educating our colleagues took a while. The other vets in the U.S., that aquatic vets and fish vets are like a real thing, whatever. So I think kind of that, it's sort of like PR, I think, is one of the things. We've talked about PR, but whether it's for our profession, our colleagues in the profession, for potential stakeholders. I will tell you, when I started working at 5D, the aquarium fish farm in Florida, their dad didn't tell the sons, and so the sons, when I showed up, they're like, we don't know what a vet's going to do for us. We have no idea. So I think just kind of, and it's a lot different now, obviously, but I think there is still a lot of education, so that's probably one thing. I think, and this is not necessarily directly related to that, but I will say, just like other fields, we've talked about even some of the large animal fields, I think the pay is always going to be a challenge for aquatic vets in general. There are some obviously that do well, but if you're going to go into aquatics or zoo or exotics, you're doing it because you enjoy it, and you're not necessarily, or most likely not going to make as much as you would in small animal or some of these more specialized fields where a lot of folks are kind of going to urban areas because they know they can make a lot more money. In the U.S., it's a lot to do with loan debt. So it's not directly answering your question, but I think part of it is, if we're going to influence, we need more people as involved in it. So I think it has a little bit of relevance, but again, I think the biggest thing is PR. And early on, I think there was a push like we need regulations. They have to use vets for fish. But I think my thoughts and a lot of colleagues' approaches is like we need to show that we do have value, and that's kind of why we talked about production. Computer programs or whatever, we have to be able to show, like, look, with us, you're saving it. And Jill did a really nice job, I think, giving some numbers and economics to the farmers. That's the sort of thing we need to do to show our value. And it's going to vary, again, depending on the area. But a little bit of a rambling answer, but hopefully that works.
Thank you very much. That was great. Thank you, Roy. By the way, that is a Madiba shirt. Named after Madiba, who's Nelson Mandela.
Oh, is it?
Yeah, that's a Madiba shirt. Awesome. Right, our next speaker is Nelly Isiagi, and she is going to present online, so we'll now listen to her presentation and then we'll take questions.
Good morning, ladies and gentlemen. What are the opportunities and challenges for aquatic veterinary and paraveterinary practice in Africa? The American Veterinary Medical Association describes the roles of veterinarians as protecting the health of animals and people, animal welfare, environment. Good morning, ladies and gentlemen. What are the opportunities and challenges for aquatic veterinary and paraveterinary practice in Africa? The American Veterinary Medical Association describes the roles of veterinarians as protecting the health of animals and people, animal welfare, environmental protection, research, food safety, and public health. This includes fish. The practice of veterinary medicine is just emerging in Africa. Within the zoological sciences, potential disease-causing agents for aquatic animals within Africa has been taught as subjects in relation to ecology. The major interest being basic research such as taxonomy and environmental assessments. A few vets would take this as a specialist area, principally for research or academic purposes, otherwise practically in relation to food safety. There was no major threat at the time for applying veterinary sciences to the fisheries sector in the typical sense, other than for certification of ornamental fish and food safety for export. Aquatic environments were not as degraded as they are today, and parasitic infestations and mortalities in fish were generally associated with changes in seasonal water quality. Incidences did not negatively or significantly impact the fisheries. Fish farming was introduced to Africa largely to improve household nutrition among subsistence farmers. Extensive low-input systems relying at most on farm residues and inputs, hardy species such as tilapia and other ponds were adopted. In a few instances, high-value species, especially in the highlands, were farmed and were also farmed for sport fishing. Over the years, national economies have begun to transform, becoming more cash-based. Even rural farmers in remote areas now required cash to access services and basic household needs. Market dynamics also began to change as the fishery catches began to stagnate. Urban markets beginning to expand, and this had a positive impact on adopting commercial aquaculture. Attitudes to farming fish consequently changed. Reliability of yields and returns on investment increasingly became paramount. Attempts to increase production and productivity at minimum possible cost, expand operations, intensify, and adopt new technology did not often directly result into linear or exponential increases in production and returns that farmers expected. Hence, the need to identify, understand, and address the causes and effects of failure. As the sector has grown, quality assurance and certification of production systems and products that include live aquatic animals has also added to the demand for veterinary services. Under subsistence farming, simply being able to harvest for consumption was adequate. But as the pictures indicate, later, the length of production cycles, the quantity and quality of yield mattered due to the implications on income for farmers. Stocking more fish, feeding more, or switching to tanks without understanding water quality management and the needs for various systems resulted in losses. Farmers had to get to understand the implications of feed processing and nutritional quality on appropriate production options. Agricultural byproducts didn't necessarily give the same result in more intensive systems. The worst case scenarios, of course, when intensification was done without matching up the management requirements, was the onset of clinical symptoms of disease, and this is when most farmers would seek veterinary services. Creating awareness and practical training for farmers is equally important, if not more important, as unless they are aware of what influences the welfare and health of their fish, losses and the spread of diseases from farms is more likely. Without such knowledge, producers won't be able to maintain biosecurity, take preventive measures, or detect cases early, and often it will be too late for the veterinarians to intervene. Since the demand of aquatic health services is just emerging, the training capacity in terms of curriculum development, facilities, and human resource capacity does not yet comprehensively address the needs for the sector in terms of content, skills delivery as compared to terrestrial animals. Acquiring specialized aquatic field diagnostic kits and other veterinary inputs is not easy. Often one might have to import these themselves. There are also limitations in supporting veterinary regulations for aquatic veterinary services, and this affects the availability of the necessary inputs, such as approved drugs. Where there are also too few farmers, the distances and accessibility to farms can be hard, and therefore it may not be economically viable for vets to travel. They would rather go to places that are within reach. There is, however, evidence from countries within the region that have invested in aquatic veterinary services that there is a positive impact on productivity and profitability where these services exist, and they've also had a positive impact on the expansion of the sector, for example, in countries like Egypt and Tunisia. The opportunities for aquatic veterinary services and paraveterinary services are broad and cut across the value chain. The aquaculture sector, including for the fisheries sector, are expanding and are as dynamic as the markets they serve. The need for standards and the quality assurance of production processes and products is taking prominence, including among smallholders, as urban markets expand and evolve. There are so many unknowns in the sector, including for the production systems that we are more familiar with. This accrues to the rapid environmental changes and their impacts on water quality and hydrology, consequently affecting production, public health, animal health, and welfare status of welfare status. Current knowledge and practices for most health conditions also need to be validated against local conditions, including of the pathogens within our environment. There are also climate change impacts that need to be taken into consideration, and we still need to understand more comprehensively the response of our animals to these changes. Thank you.
It's time for questions. I believe that Nelly is online to answer questions. We don't have any online questions. Nelly, do you have any ideas on the way forward for Africa?
Yes, I can.
Here's a question coming up.
I beg your pardon?
Good morning, Nelly. I just wanted to find out,
So why
based
did-
on your
why-
experience,
Okay, why?
can you hear me? Hello?
Yes, I can hear you.
Oh, okay, good morning. I just wanted to find out from your experience, how supportive is the regulatory framework? How supportive is the regulatory framework in terms of enabling access to, say, vaccines or autogenous vaccines for aquatics in Africa or maybe in East Africa?
Currently, there is nothing. When someone brings in the vaccines, you would require to get special clearance from your chief veterinary officer. And in most cases, if you're bringing in new drugs that have never been used, whether it's anesthetics, the antibiotics, you can get away with it because it's the same family of lupus. You have to do the baseline studies and tests yourself, the impact assessments. You, the importer, pays for the costs. And that is what makes it difficult to import. And that is also a situation that has compelled many, especially the large producers who have access to the external markets, and unfortunately, many of the multinational companies, they bring in things through the back door. So you find, things happening, but you don't really know. And that's why, like under AUIBA now, we're stressing the need for veterinary governance. The drug formulary for each country now, we have to start clearly defining what the approved drugs are. Vaccines, as a continent, we've got PanVac that is responsible for quality assurance. Because when people bring in things themselves, even your supplier, you have not authenticated the supplier. I have also had experiences, like personally, when I was working at the research station, when you import something, especially when you're from within Africa, they know you have no legal backing or support from your country or your government. So they deliberately send you the substandard items or things they want to dispose of. And when you approach them that, this is not what I ordered from the catalog and this and that, they don't respond. And when you go to the authorities, like to get assistance, because there's nothing in the regulations, it is not specified that you can import whatever, there's nothing they can do. Now, these are some of the challenges aquatic vets face. And then when things are not registered as veterinary inputs, you're taxed. You have to pay the income tax and the import duties. In most countries, agricultural inputs, especially within Africa, since it's our basic industry, agriculture, they are tax-free. You only pay the service charges. Now, all this has implications, especially if you have a young and emerging industry. The cost is borne by the farmer. If it is a well-developed large industry, you can get turnover because you have larger farmers producing more and more. So those are some of the challenges. And those are the challenges that also hinder the professionals adopting technically best practices. Therefore, like in my case, in my experience, I had to rely now more on epidemiology and preventive medicine. And that's why I had to teach the farmers, for example, to get data to do your own health management. And then you start like to control the number of parasites. We found where the hotspots were. And then the farmer starts determining how frequently he should clean his pipes or his drain, because you're getting surface water. And that would have an immediate impact on reducing the parasite loads on the fish. So it was simple things like that. And as I said, there are many unknowns. So like myself, like those pictures and the comments I put, the remarks I remembered from the farmers when they would call me that I've got an emergency, come and see this and this. Of course, they've not followed your guidelines. They think that when you tell them reduce the stocking density, that she just doesn't want this. But when they get into a mess, they go, come and see, someone has poisoned my fish. So those were the remarks. I was remembering what was going through. So you find, like, for example, Aeromonas, I would diagnose it at the time. But now, since there are more students and facilities like the veterinary faculty, you find that the Aeromonas affecting the fish, the species, we have 3 species in Uganda: Hydrophila, Sobria, the Cave, and Salmonicida. And then Hydrophila, there's a high genetic diversity. So for example, if you're to have control measures like develop a vaccine, that is another risk factor. And progressively, as the industry has grown, you find some bacteria like Aeromonas are more prevalent in cages. Edwardiella is more prevalent in ponds. So you're starting to see, what the issues in the different systems. Same potential pathogens, but their impacts are different under different management systems and their prevalence. And this is where, even for field vets, if they had proper diagnostic kits, and they are linked like to the laboratory services, that they are easy to access, you will be able over time to collect this data cumulatively, and then it evolves into getting well-informed information and the most appropriate treatment measures. Because sometimes, yes, the animal can be infected, but it does not fall sick. Under the same conditions, it's affected by the same species. But yes, you get high mortality. So those are some of the issues that.
Thank you, Nelly. Thank you very much. There's a lot of work to do, obviously. But thank you very much for your contribution, and we wish you well.
Thank you. You're welcome.
Our next speaker is also going to be online. Professor Dusan Palic. I hope I've pronounced that rightly. He's a Serbian, so a C should be Palic. He's actually a 3rd generation university professor in veterinary science. And having studied in Serbia, he's now working in Germany at Munich, and has an extensive experience in the field of aquaculture, particularly within Europe, has been very active in WAVMA and the OIE and many other fields, and he is then extremely well qualified to talk to us about the principles that underlie biosecurity in aquatic medicine. So we will listen to his presentation now. Over to you, Professor Palic.
Good morning, everyone, and welcome to the conference of the World Aquatic Health in 2022, together with WAVMA and University of Pretoria. My name is Professor Dusan Palic. I'm from Munich, and I'm a Director of International Aquatic Veterinary Biosecurity Consortium. Today, I'm going to talk to you about pathway to disease prevention, control, and eradication using principles of aquatic veterinary biosecurity. And the co-author of the presentation is Professor Dave Scarf, who I think you will also meet on some other talks. I'm going to talk today briefly about why is biosecurity important and what are the most important international standards and efforts performed by the WAVMA, or the World Organization for Animal Health, formerly known as OIE, and FAO, UN, Food and Agriculture Organization of United Nations. Then I'm going to follow with the illustration of the IVBC approach and how we can really start implementing aquaculture biosecurity on a daily basis. It's important to notice that growth of aquaculture has been tremendous in the past 20, 30 years, while capture fisheries has been leveling off. And that brought us to a situation that actually aquaculture overtook capture fisheries by about 2 million tons in 2021 by the overall production. Another interesting point is that the predictions are that by 2050, for the growing human population, that actually, by estimates, over 8 billion people reached on the 15th of November, we will have very limited time to provide over 50% of edible animal protein by aquatic animals at this time that's short ahead of us. Common aims of everyone involved in this game is basically money. So we need to make sure that producers maximize production, have some value added to their certified products, and protect their investments using the biosecurity principles. On the other side, or not on the other side, but kind of from the different stakeholder perspective, governments want to protect their industries to increase production and, of course, trade for revenues, but also to do that with meeting regulations that prevent disease spread, which is also the main point for the international NGOs or non-governmental organizations such as World Trade Organization and the SPS agreement, sanitary and phytosanitary agreements. They prevent disease spreads across the countries, they protect domestic industries, and meet international requirements. So all of these has to be satisfied as a common aim for all of the stakeholders with a proper and functional and useful biosecurity plan and program. We are evidencing a problem that aquaculture growth rate is declining. So for the past decade, it's about 4.3%, while in the previous decades, it was closer to 5 or even sometimes over 8% in global scale. What's going on? We have participated and learned about the survey from the Global Aquaculture Alliance, aquaculture survey from all the countries, that 2 out of 3 top concerns about sustainability or problems related to sustainability in aquaculture industry is related to diseases. The first and foremost, the extreme problem that is viewed by the stakeholders is disease itself, and also access to disease-free brood stocks. When we consider different sets of impacts of disease outbreaks, both in aquatic and terrestrial animal diseases, an analysis by our colleague Katinka de Balog from a few years back showed some major impacts of animal diseases. We superimposed aquatic animal disease impact in the monetary values that showed us a significant point that it's comparable, the impact, the monetary impact, financial impact on aquatic animal diseases, direct and indirect of the estimated costs, can be comparable to foot and mouth outbreaks in the UK back in the 90s, and then also with relative to coronavirus, the SARS, or the Southern Acute Respiratory Syndrome. To shift back a little bit and to help understand the concepts that we have been developing, this is not something that just came out within a few minutes. It was actually an outcome of a lot of international work and collaborations with many, many people over 20 years that was spearheaded by OIE and FAO, or WAC, formerly known as OIE. It was tested in different continents And I'm actually relatively happy and proud to say that these concepts have been included and evolved over time to be now set up in the new chapter of WAG, and also for disease prevention and control. They give recommendations to nations and countries, and they deal with how we can diagnose disease, how we can make surveillance happen, and how we can notify authorities about the disease outbreaks. This all is really connected to importance in trade, imports, exports, and health certifications to prevent spread of infectious diseases of high importance. Now, in this setup of the OIE Aquatic Health Code and Manual, prior to last year, really, OIE only, or WAC, only addressed basic biosecurity without clear indications of how to apply it. And I'm happy to say that this changed. So recently, about a year ago, or a year and a half ago, the new chapter was adopted, Chapter 4.1, for biosecurity for aquaculture establishments, that has provided a revised set of definitions, applications of the standards, recommendations on biosecurity to be applied in different ways and different environments, but all relying on very similar, actually the same principles. Approach from the FAO was to build up something that is related to a progressive management pathway through several stages, starting with risk assessments, through building biosecurity managed in specific sectors at the national level, and finally the system that is encompassing all. So this is a broader scale, larger scale approach. What is in the core and like a baseline or underlying principle of all biosecurity plans and programs is the epidemiological unit, or the epidemiologic unit as a defined population of animals separated to some degree from other populations. And in this population, infectious and contagious diseases can be relatively easily transmitted. Based on the epidemiological unit, different sizes can be the establishment, such as a farm or a complex of farms, different compartments and zones, even regions of different countries or countries themselves, or even larger epidemiological units. As long as we apply the same set of principles on epidemiological units, it doesn't really matter what particular disease is in question. Therefore, in the IVVC, or the effort of International Aquatic Veterinary Biosecurity Consortium, we have started or prepared after a long time that the system that we think we can be applied to any epidemiologic unit. We divided this set of steps into three areas of the schematics, and separated this into questions that the farmer or the owner of the epidemiological unit or the people who have interest in the epi unit might ask. Then the second or the middle and the core of this schematic is the formal biosecurity process or step that's undertaken based on the questions from the farmer in this case, and what are the documentation and records that need to be presented and kept in order to finalize the plan and recordings of our efforts to improve biosecurity. So just as a simple example, we start with which diseases would be serious potential hazards to my particular information. So the principles apply to everything, but the situation is very, very individual. So we go through the hazard identification and prioritization process. We come up with a prioritized disease list, then we estimate the risk of these diseases, evaluate critical control points, and so on, with the ultimate goal to have actual governments recognize and allow the third-party disease freedom certificates that would be then used in international trade as government-endorsed certificates of veterinary inspection. So objectives of effective biosecurity really are much more than just washing the hands and hygienic practices, quarantine units, etc. It should be evidence-based. So we need to have evidence that something that we are doing helps and that we have clear endpoints of what we want to achieve. We have to have a standardized approach that is scientifically sound, and we have to be able to justify this both in expense and the time used to make an effort to change some of the principles, to change some of the procedures on the farm. Any objective that we have has to encompass disease prevention, control, and potential eradication, meets regulatory requirements at different levels. What is important is that we need to keep business continuity. So our efforts to increase biosecurity have to fit with routine production systems to be economical, practical, efficient, and effective. And also, what was our interest in this is to offer incentives to producers, veterinarians, and governments in the form of rewards, or however you want to call this, for doing a good job and good work in disease prevention and control, and be awarded or rewarded for this through cost-sharing programs on private-public partnerships. We have several critical features in any biosecurity program. It should be focused on prevention control of infectious diseases, so not non-infectious like food poisonings and stuff like that. We're talking about infectious diseases only in this case. And in this particular situation, when we talk about infectious diseases, the biosecurity program should be applicable to any disease and any type of operation following the same principles from the farm to the nation. So the only difference is the size of the epidemiological unit. However, it's very individually tailored to each of those epidemiological units when it comes to the real life situation and application of principles. It should promote business continuity, as already said, so it should be practical, economic, it should be incentivized and fits routine production systems. Ultimately, it has to meet international standards and national regulations both. Therefore, the primary focus on the ultimate objective of biosecurity is to ensure that an epidemiological unit, no matter how big it is not diseased or infected, and that it should remain that way. how do we do this? Very practical approach that we have been trying to develop and then teach to colleagues in different continents is that, again, we focus on applying biosecurity to an epidemiological unit itself. In this particular example, we are working at a tilapia farm that has about 150 tons of annual production. This is, again, just a virtual example. It has integrated production, meaning that it sales and buys live fish, larvae, and fillets internationally, imports some of the stuff such as broodstock and eggs, uses both river and groundwaters, has some visitors, and about 50 employees. However, this farm does not have a biosecurity plan in place. Therefore, it has high risk of a disease outbreak. So the first step in this process, as discussed, but as applied individually for this particular farm, is that if a farmer asks which diseases are serious potential hazards and follow up with questions such as, is my farm at risk of these diseases? How much risk and what is the impact of this particular disease that we identify as a hazard is going to have on my farm? We go through first formal step in biosecurity process, which is hazard identification and prioritization, come up with a prioritized disease list, followed with the risk impact assessment of these diseases and evaluation of these impacts on that particular epidemiological unit, in this case a farm. And when you do follow, you ask yourself a question again, which important diseases are present or can potentially affect the farm or epidemiological unit? What might be the impacts from these diseases that are happening on my farm? Do I have decreased production, mortalities? Do I have increased costs because of antibiotics application or vaccinations? Do I have negative product demand? Do I have fish that look so ugly that price is rock bottom for these fish? What are the regulatory restrictions that come with this disease situation, if any? So we create prioritized disease list that's based on severity of potential impact. We use qualitative or semi-quantitative risk impact analysis matrix that basically goes through the likelihood or probability of something occurring versus the consequence and potential severity of the impacts that might be occurring. And the rather it goes on this screen or the higher their value is associated with estimates, we have the higher or lower risks available. Simply put, if we identify this, we have now a disease list. For example, for tilapia farm, usually tilapia lake virus is a big concern. It can be of high risk because there is importation going on. It can have high impact because it's a regulated or in the emerging list, disease regulated. In some countries, it's already state regulated. It can be lethal. And going down the list, there are some bacterial diseases such as Streptococcus cini, which is high risk level because it's already out there everywhere, already present in the farm. But the impact may be moderate because even though there is a high morbidity and potential mortality, it's still unregulated disease. So the authorities do not need to be involved. And so on and so on. So I hope you get the idea about how based on the risk level and the impact, we identify disease hazards and rank them in a priority list. Now, when we have this priority list of diseases and potential problems that come with it, we can determine and mitigate critical points where this disease can enter or leave. So the question, where can these diseases get in, follows with a process or a step that's critical control point evaluation. Once we identify correctable CCPs, we can ask the question, okay, so what can I do to prevent this situation of disease entering my point, which is the action of mitigation, management, and remediation of risks from the CCPs, and the document is how we actually implemented corrective actions. Simple example, we have to determine which are critical points using our knowledge of the disease, knowledge of the farm, particular farm, and the particular disease that we're talking about. So the principles are the same, but they apply individually to this situation. So what are the vectors? What's the personnel doing? Any animals, water, feed, and so on? What's going on at a farm can help us to determine these critical points. And of course, the ways to rectify if there is a problem with a critical control point. So we can control the exit with a gate or entrance with a gate. We can control visitors by asking them to sign in or blocking them out. We can control some of the water incoming with the filtration unit, with the disinfection systems, and so on. Once we develop these couple of initial steps, several initial steps, it's important or very important to do development of contingency plans, because the isolating, quarantining epidemiological units is based on what we have been planning to do. It's very bad and poor management to have the situation of disease outbreak and then we start thinking about what needs to be done. No, we should already have this in the contingency plan to follow immediately and rapidly after the occurrence of a disease. So basically what we're looking for in the contingency plan is how to isolate immediately, who to call, where to communicate the disease outbreak, how to reevaluate after the fact and correct critical control points, or coming back to step 3 and 4, how to implement recovery from and to keep the business running. Do we need to kill everything? Do we treat? Do we vaccinate? And so on. To help us with all this, and I will not be spending too much time on these steps because other colleagues will discuss epidemiology and surveillance much better. But if we want to know if there are any of the priority diseases already on the farm, and how can I continue to look for these diseases during my business continuity, we should think about how clinical evaluations and diagnostic testing is done routinely and what is the ongoing surveillance and monitoring program for diseases. Both of these are documented in our farm, laboratory, and veterinary records of the results of these evaluations and diagnostic testing. The next and close to final step is once we have in place our disease priority list, critical control points, contingency plans, and actual surveillance and monitoring implementation in place, we now can do some of the steps that are related to other people recognizing our work and certifying that our facility or epidemiological unit or farm in this case is disease or specific disease free or free of certain pathogens. So we are working with our veterinarian to complete audits and certify us. And ultimately, if this is satisfactory to the authorities or government, we can actually get government-endorsed certificates of veterinary inspection or certificates of veterinary biosecurity. Just a quick distinction between audits and certification. Audits entail periodic site visits to verify certain things, such as the process is already in the place, to examine documents, to help the farmer assist them in correcting deficiencies, and of course, look for clinical disease processes that might be going on. While certification is something that we as a vets or I as a veterinarian would issue as a document to validate that these processes are in place, which is the level of expected biosecurity and what is the disease status of operation. What we're trying to do with IVBC, we try to promote active learning through different training workshops. And we've done this multiple times across the years. The what we're trying to do is that we have 1 day of theoretical and process introduction to veterinarians, producers, and government officials. Then we have 1 or more days of tabletop exercises and modeling scenarios that are based on real life situation and real life farm that we visit on the last day with an on-farm biosecurity plan and program development exercise. Some further readings, of course, if you're interested in expanding your knowledge, attend some of the workshops that might be available in your country or in your neighborhood in the next period of time. But also in preparation for those, we encourage you to go forward and read some initial work that will help you better implement some of your plans and programs in biosecurity. With that, I thank you, and the floor is open for questions.
Thank you very much, Professor Palic. Open for questions. Are there any questions online? There is one. Oh, there's one up there. Now we'll need to have Dr. Palic, Professor Palic also hearing what you say.
Yeah, thank you very much. I hope I'm audible enough. I was just interested to understand how best one can evade the diseases which are coming with, the fish feed. You have shown some critical points, and some of them are easy to do, maybe the foot bath or the tire bath. But I just want to know how you can do it with the feed. Secondly, you are talking of confirmation on disease freedom. I don't know if a farm is infected, how many years can you do the checking so that you can declare that the farm is free from the disease which infected it previously? Thank you.
Sorry, Prof. Palic, we have a problem. Have you perhaps muted yourself because we can't hear you? No. Maybe we'll have to speak in sign language. So the questions were, did you get the questions about food, and then this, how do you certify? Yeah, okay, well, we'll try to get the linkage, and hopefully this can be rectified.
We also have a question for online.
Okay, there's a question online. Could you please read it out? Okay, so we're just going to rejoin online and hope that the connection is correct this time. Technology, it's wonderful and awful.
Is this better now? Can you hear me?
We're waiting for those answers.
Can you hear me now? Now I cannot hear you. Okay, but I did get the first two questions from the colleague. I guess the first one was about food as a vector or the fomite for introducing infectious diseases. one of the simple possible things that might be, well, it's not that simple, but one of the possible things is to, of course, buy food from the supplier that has good hygienic practices, that has proven or tested that his food is specific pathogen or certain disease-free or the low risk. So that's one of the approaches to get into this protection of your farm from poor food quality that would be bringing the disease with it. These are probably more witnessed or more important for farms that buy live food or buy just raw ingredients and then try to make their own food rather than buying, complete bagged pelleted food from a reputable supplier. The other question I think was related to the frequency and the duration of diagnostic measures such as surveillance and ongoing disease monitoring. There are a little bit differences between what's actual surveillance, what's monitoring, related somewhat to the level of regulated on unregulated diseases. However, this is something that is to be decided both at the level of the farm or the epidemiological unit, but also at the national regulation level. So if your government eventually decides that this period of time when you have to keep your farm tested and retested and retested and prove that you're disease-free for a certain amount of time, it's really depending on the national regulatory body to say, yeah, this is enough to do this for 100 years, or it's enough to do this for a year or two. What we have seen in many different examples is that it looks like it is a couple of years, I would say, probably would be a good way or good duration of time of relatively frequent monitoring and surveillance control. However, there is always a point that you have to decide, okay, I did this, but then I changed something. I changed my supplier for the broodstock. I changed my supplier for the food. And when something is changed in the system that's already being claimed to be disease-free or specific pathogen-free for certain disease, then you have to keep on monitoring for a little while longer, just in order to be sure that your change did not also introduce some of the other risks in your system. So it's not something that the farmer decides on its own or on his own, but also it's something that the government officials and the regulations for the certain area or the country or zone are dealt with.
Thank you very much, Professor Palic. Unfortunately, we don't have time for another question, but we very much appreciate your contribution today.
Well, thank you, and thank the organizers, and thank others that are attending. Bye-bye.
Thank you. Goodbye. Our next speaker is Neil Rauch, who is a very special person in this conference because he represents the farmers and their inputs and what they expect of our veterinary involvement. He's a systems engineer who's become a farmer, so he's well placed to help us in that regard. Mr. Rauch.
Are you going to move it on, or shall I? Good morning, and thank you for the opportunity. Small farmer, started out 11 years ago. It's really an aquaponics farm. But over time we realized how important the fish portion of that is. And the fish portion just grew and grew and grew on us. Made many, many, many mistakes. So it's urban aquaponics, and then we've got aquaculture innovations. I'm going to show you a small clip. The clip, some of the information is slightly old, but it really gives us an impression of what's happening in the sea and what's happening with farmers. Somewhere. Ah, there we go. Oh, it looks like this. The audio seems to be missing. Oopsie.
Returning home with empty nets.
Yep.
The Earth. There are currently 7 billion people living on 30% of its surface, and all of them are dependent on the remaining 70%, the ocean. The ocean is the largest source of food in the world. Fish is the main daily source of protein for 1.2 billion people. But fishers are more and more frequently returning home with empty nets. Let's turn the clock back a little. Some scientists say that in the last 60 years, stocks of large fish have fallen by 90%. They are warning that we are facing the collapse of all types of fish species in less than 50 years. The reason for this? Overfishing. Longline fishing vessels deploy 1.4 billion hooks a year. 1.4 billion hooks, each with a slice of fish hanging from them as bait. There are trawling vessels that cast nets with an opening of up to 23,000 meters squared, the size of 4 football pitches, and big enough to hold 13 jumbo jets, or more commonly, more than 500 tons of fish. Amongst these 500 tons of fish, there is a lot of bycatch. Bycatch is marine creatures incidentally caught, often at large quantity. Typically, shrimp trawlers throw 80 to 90% of the marine creatures caught back overboard. This means that for 1 kilo of shrimp, up to 9 kilos of other marine wildlife is caught and wasted. To relieve the strain on wild fish, 47% of our seafood demand is farmed fish. But marine aquaculture is more of a nail in a coffin than a lifeline. Many of the farmed fish are carnivorous. That is, they eat other smaller fish. 5 kilos of captured wild fish are needed to produce 1 kilo of farm-reared salmon. Aquaculture just converts low-value small fish into higher-value bigger ones. It does not create more fish. The majority of European fish stocks are overfished. Historically, EU fisheries ministers have set fishing limits exceeding scientific advice. In 2008, fishing limits were defined for the highly prized bluefin tuna. Scientists recommended a fishing limit of 10,000 tons to rebuild the increasingly depleted population. However, the EU and other fishing nations decided on a fishing limit of 29,500 tons, 3 times what scientists had suggested. Then, despite this already inflated limit, 61,000 tons of bluefin tuna were caught. That is 6 times more than the recommended limit. Billions of euro in public subsidies are fueling this overfishing. If this continues, soon there will be no fish left. How do we end overfishing? Your politicians have the responsibility for making the decisions in Brussels that will end overfishing. Citizens have responsibility of encouraging and supporting their politicians to make those decisions.
Okay, and a little bit closer to home, we've got the African Union, and the African Union makes these decisions. So because our country, South Africa, is so involved in the African Union, some of those decisions, in my view, are not completely right. On the 14th of November this year, the world moved up to 8 billion people, not where we are at that stage. Okay, so one of the things is the use of water. So in South Africa, for instance, we are now being asked to get water licenses for fish, if you're farming fish. But if we look there, the amount of water used to grow the fish, to grow it, we use 544 grams of feed to move it to 1 kilo. But we only use 3,700 liters of water. Our next friend, oopsie, oh, sorry. Our next friend, Mr. Chicken, 7,500 liters. But we don't need a water permit for them. Our next friend, the pig, 13,000 liters. And the cow, 9,000 liters. Why do we need a water permit to have fish? It remains a question. So, a little while ago, there was a person wrote a thesis, and it was specifically about what is happening in aquaponics. But remember, aquaponics is so dependent on the fish. And he said, okay, so I went on a tangent, and I said, I'd like to see what he wrote in the thesis, if it is correct. We had to send water samples away. There weren't even labs in South Africa that could do all the samples for us. So I had to send water samples away to the UK, and it had to be treated like medicine. It cost a lot of money. And that's what he said was in there. So, I mean, that's all nasty stuff in an aquaculture and an aquaponic system. So we sent it away, and it was all absent. None of what he had said we had found in our system. Therefore, we were awarded the Heart and Stroke Foundation and cancer, scientifically proven healthy, fish and plant. Our farm, it's an aquaponics farm, and that's the fish house. Many, many mistakes, which you'll see now. Okay. So farmers and aquaculture and aquaponic farmers, mostly in South Africa, start small, and as they move on, they grow their farm. That's what happened to me. But we have challenges. I started with what fish was not? It was a lot of Mozambicus. I started with Mozambicus, which is a tilapia species, of course. And then we moved on and started real fish, as I call it, which is rainbow trout. Very hard to keep. It needs high dissolved oxygen levels, and it needs cool water. And that's what happened. That's one of the reasons why I moved away from tilapia. But what really happened was the guy who was working in my garden scooped some water out of the dam, and in the water, in the drum, there was a spray, and that killed all those fish. One shot. He didn't admit to it, but we were able to look at the recordings and then saw exactly what had happened. But our challenge then was we couldn't find a vet. We couldn't find a vet anywhere that understood fish. They were available, but we didn't know where to find her. So we're still learning. We were lucky to be able to look at our own design. We built our own system, and we started sanitizing long before COVID. And that's what it looks like. There's an entry, and you walk through the second door, that's after you've cleaned your boots, and you walk into the fish house. There's a siren that screams if you haven't washed your hands. And then I can see who hasn't washed their hands. So we know, we ensure everybody moving into the fish house washes their hands. Okay, we didn't practice what we preached. We didn't have a quarantine area because our new fish moving in was from the same farmer for many, many years. We received a batch of fish, and within a week, things were not working well. It's a recirculating system. So all water from all the dams returns into a sump and then returns into there. No quarantine, many, many fish died very quickly. We didn't react fast enough, or I didn't react fast enough. And we had losses. We've only got 5,000 kilograms of fish in the system now, so 970 kilograms of fish within 9 days is not good. But not knowing what was wrong, that's where our challenge lied. We didn't know what had gone wrong. We found out later, yes. And then we started really looking at our fish. The interesting bit, we can always identify the problem. And that was at a late stage, of course. I think Dr. Gillian Taylor, that first loss of ours was a major loss. And the major loss was a parasite. On Saturday, we had a conference, and there was a professor, I forget her name now, and she said she loves parasites. A fish farmer don't like parasites. They are there, they'll always be there, but she loves the parasites. So lessons learned, we altered our system, including a switch over to quarantine fish. So now I'm over-zestful on that. New fish comes in, I watch them, and I watch them, and I watch them. They remain in there until I'm 100% sure. Also, we stopped just watching. We said, send away the samples. Have a look if those fish are healthy. You don't want to lose all your fish. Again, Neil. We also then acquired our own microscope. Wow. I mean, at one stage as a farmer, you don't think of that. Why do I need a microscope? I don't even know what to look for on the microscope, I mean on the fish. So we had no idea what we were looking for. We had to learn those processes. So even a small farm needs to understand what's happening on those fish. Okay, so that was the past. All the lessons learned happened. We sorted out our quarantine, we sorted out the health of our fish to a certain extent, and we know that we should not have any more losses. I know what happened. We had more losses. We didn't realize that there was a problem on some of the fish, and it was a gill disease. Hard to identify. As a farmer, impossible to identify. So we ran to the vet. Unfortunately, in South Africa, I could not find insurers that will insure fish. I know it's high risk, but they don't want to insure fish. So we are saying, as farmers, we should start our own, I don't want to call it an insurance, a little investment program. Every month we rent certain equipment on a farm, and we don't mind that rental. I think we should start by opening up a rental for our vet. Make sure we have a vet. You think it's a lot of money, but it's not. But you might think you don't have the money. So every month invest that little bit like a rental. We need to Africanize aquaculture in South Africa and in Africa. We need to understand what's happening, specifically in southern Africa with our fish. We need more vets. There just aren't enough vets that understand the fish sciences. Know what's happening with your fish, understand it every single day. The guy that feeds your fish is your most important guy on a fish farm. Most important guy. Because the fish speak to him every single day. He knows when something has run wrong. He knows they're not feeding as well. He understands those fish. He's the most valuable guy for you on your farm. Don't stand by and let your fish die. Because that does happen. We don't. We don't stand by and wait for our fish to die. More than 3, and I'm up in arms. Thank you.
Questions? Comments? What a supporter we've got. That's what we need. You know, I'm in the terrestrial animal world, and I know that if I can get a couple of farmers, entrepreneurs, to get going, they actually are the best ambassadors that you can hope for, because other farmers will listen to you, they won't listen to me.
You see, we were hurt so many times and it's not only myself. There's quite a few farmers out there that have been hurt. And 90% of the times it's their own fault. Stupidity, number one, because I was stupid about all of these things. But the main thing is bring your vet. Find a vet that will visit your farm. Once a month if you have to. Everybody thinks, but the 3,000 or 5,000 rand is a lot of money. It's not when you lose 300,000 rands worth of fish.
If I can just add a comment from my side as a vet with working with Neil and with some of the issues that we had. It wasn't only Neil who learned lessons, I learned lessons as well, particularly about the rapidity of how disease spreads. So when he had his initial problem, you know, by the time we had sent samples away, waiting for cultures, the losses climbed like this. Very often it takes a good 5-7 days to get a culture result back from a lab. And in that time, sometimes the losses can be so significant. So a lesson to me in that was if you suspect something bacterial, infectious, perhaps start with a baseline antibiotic as a vet, just to start mitigating some of the losses, particularly in a high-value species like rainbow trout. And then obviously just modify your treatment regime based on your sensitivity results that you get back from the lab thereafter. So I think, yeah, it certainly taught me as well that as a vet, one needs to move really, really quickly as well. Thanks, Neil.
Thank you so much. One of the things that we've learned in terrestrial livestock is it takes money to make money. And we've got to get that across. You can't only make money by saving. Thank you very much, Neil. We appreciate it. Okay. We're a little bit behind time, so I'm going to ask you to go to tea now and be fairly quick so that we can be back by, do you think, 11:15, if at all possible. And remember, there are now 3 streams. Stream 1 here, stream 2 next door, and stream 3 beyond that. Thank you.
that we have everyone who has planned to be here for session 1. Our first speaker is Dr. Johan Stale, and it's going to be a recorded presentation, and there will be no questions and answers afterwards. So we all know Dr. Stale, and he was introduced yesterday, so I'm not going to go into his CV this morning, but his presentation this morning is going to be on the role of histopathology in aquatic diagnostics. Thank you very much.
Good day. Yeah, I'm Johan Stale. I'll be talking to you about the role of histopathology in diagnostics, specifically in aquatic diagnostics as an example. However, as most of you know, this applies to anything really that you want to investigate microscopically. So let us, before we continue, first take a step back into the diagnostic process. And for that, we first have to look at what is a diagnosis. So you can go into Google, it's got a very nice little definition there, a medical and veterinary definition for the art or act of identifying a disease from its signs and symptoms. Okay, so science can be broadly also expanded into further diagnostic tests and results yielding from that, and then finally coming to a diagnostic conclusion. But then again, you can also expand this into any situation or scenario in life where any of you investigate or analyze the cause or nature of something that goes wrong. If your car is not starting in the morning, you would want to make a diagnosis of why it's not working today. And in that instance, you are likely to follow specific routes. So if you have an expert at home, you will contact a person. If you're an expert yourself, you'll resolve the problem yourself. And in many instances, when it comes to our animals or our pets or our farming enterprises, we will attempt to do the same. And that is where you can fall into great problems. But yeah, so let us just look at this a little bit closer. Right, so let's look at the diagnostic process, and first we are sitting or facing a dilemma in terms of how far do you go, on how much evidence do you make a diagnosis. And this is going to differ from person to person, depending on the person's skills, depending on the person's experience. And also, you know, the illustration I want to show you here is also going to point out the issue with repetitive mistakes that are made out there, and what we should not, or what we should guard against. So have a look at this little video and then take it from there. I try to make. Right, so now that we are in a diagnostic approach, let us just get a clear picture in our minds about what it all entails. Essentially, you sit in a veterinary scenario, you sit with a case of an animal with poor health or even mortality events, and then decision making that needs to take place. So depending on who you've got involved, the history has to be assessed, and the clinical and findings need to be assessed, and based on that you're going to make decisions. Either the case is going to be resolved and you're going to go straight to a diagnosis and the resolution, or you're going to want to follow further diagnostic tests that you will require to get to a final diagnosis. Unfortunately, a lot of the times farmers, pet owners will attempt to make their own diagnosis and follow straight to the resolution, where they will treat for something they think may be the cause. Sometimes the animal will respond and you'll get a positive outcome, Unfortunately, that doesn't always mean that you've made the right diagnosis, and that is where people make the big mistake, because the animal can recover despite or in spite of what you've done. If you do follow the diagnostic route of making a diagnosis, then at least you know what you're sitting with, and you know that you are approaching this particular problem in the correct manner should it happen again. So veterinarians or medical physicians will take this particular approach where, depending on what they find in the history and clinical picture, will decide to take samples. Now, histopathology is the first line of diagnostics that is often approached, especially during mortality events. And the reason for that is because essentially histopathology just expands your macroscopic field of observation that was clinically performed. The results, however, of these tests will have to be interpreted by a skilled person. Many of these results will come back as either just a positive or a negative, and you need to understand what the diagnostic test was based their results on before you can in fact get to a conclusion of a diagnosis. So just please remember, a positive or a negative does not make a diagnosis. You still need to interpret the whole batch or the whole basket of tests that was performed to reach a specific diagnosis. And then the obvious path is then to get the correct diagnosis, is then to apply the correct treatment or preventative strategies for the rest of the population to restore everything back to health. So that is the correct way of doing it, but be careful of jumping the gun too quickly from just what you are seeing macroscopically in your situation. Right, so let's focus on histopathology now. So what is it? What's the definition? It's a branch of pathology that's concerned with morphological tissue changes that's characteristic of disease. So this is key, because what we are looking at is in fact the response of a tissue to a specific insult, and the response of the tissues to specific insults vary, and it's based on that or the physical microscopical presence of the insult that we base our diagnosis on a microscopic level. So essentially we look for this, and with the right experience you can come to the correct conclusions. It is essentially then, to simplify it, it's an observational extension to the cellular level. So what you see macroscopically, what you can't see macroscopically, is then just extended to the cellular level, where you can then look at it with obviously the right experience, and then make the relevant conclusions. It's a very old diagnostic technique. It's as old as the invention of microscopes, essentially, and when people started looking at things under lenses. And it's, I think, for that reason that many scientists in the field will just shove histopathology or microscopy aside as an aged technique with no relevance, and diagnostics based on molecular work has been erroneously been done a lot of the time, and still are being made to this day. Histopathology has to be, in certain instances, obviously with reason, be your first approach, and at least be part of the basket of tests before you make a final conclusion of diagnosis. Let us look at the downfalls and advantages of histopathology. So many disease conditions manifest with typical cellular changes. We've said that is one of the things we base our diagnosis on. What's very important about histopathology, since you've got a bird's eye view of what's happening on cellular level, you very often will find the insult, especially if it's an infectious organism. You can see the battlefield between the cells and the particular insult that's present. So you can actually see the relationship. That's very different between when it comes to this scenario and, for example, molecular work, where a positive result just means that there's a presence of a particular organism. It doesn't mean it's actually causing a lesion. Therefore, lots of false diagnoses can be made if you don't know how the test works and how to interpret the result coming back. Okay, so that is the key thing. So it's understanding how the test works, understanding what you can do with the result. That is the key thing that requires some skill, and that is where your veterinarian comes in and plays a very important role. It covers all classes of conditions. This is the only test that does this. So it's quite a generalist in the diagnostic field, and that is also why many believe it should be your first line of diagnostics, since it will provide you with direction. It will provide you with diagnostic direction, which test next may be necessary, and sometimes, and very often in fact, in my experience, it can even be the final test in the series of diagnostics. Okay, so I've discussed that you will actually catch the cause in the act of causing the disease, which is an important advantage. You don't also have to anticipate what the cause could be. So even if you are quite inexperienced, you're going to be able to sample a tissue, especially if it's a mortality event that you don't have to have anesthetics involved and things like that. But you can sample tissues and you can send it for histopathology. You don't need to, in fact, anticipate what it could be. The histopathologist would guide you in this process. So it doesn't really need a high level of expertise. A lot of you are going to be part of the workshops, are going to be exposed to how to sample tissues for this particular procedure. Very cost effective as well, not a lot of expensive chemicals and tools and machinery that's required in the sampling and submission process. So that is, at least in that respect, it's very cost effective and easy to perform. And in the world of immunohistochemistry, which is essentially the tool that will increase the sensitivity and specificity of histopathology, which can be a pitfall as we discuss now. So as I said, you're going to then, the next level of interpretation is the key thing, where a highly skilled personnel is required, even for processing as well, and that can be obviously a disadvantage as well. So we have to process the tissues to a level where we can in fact look at it under the microscope, and that requires quite some skill, and the interpretation is very important as well. You are dealing with a person that is dealing with the tissues under the microscope and not a machine. So it's quite a test that requires experience and quite some training as well. It can also yield non-specific results. Many tissues will react the same way to a variety of different insults, which makes the specificity quite variable as well. But as I said, with the invent of immunohistochemistry, this has changed and is bound to change even further. Conditions of disease at the subcellular level is difficult to see microscopically, or impossible to see microscopically. This may change in the future, but at this time it's certainly not possible. So there are certain, especially intoxications, that cause mortality or death of cells at a subcellular level, and you cannot tell what is causing it. But even though, if that is the case, you can at least rule out many different conditions that would have caused cellular changes that would have been visible. So you will be sitting with a list of differential possibilities that in fact is left to be looked into further. So it certainly decreases the number of additional diagnostic tests that may be required to reach a definitive diagnosis. Its sensitivity for a screening tool is extremely poor as well. So in healthy conditions, healthy populations, histopathology is not a very good tool to use unless there are sub-lethal or clinical problems that can manifest at a cellular level that may be of importance, especially if there is production problems in intensive production systems. So that can be used as a screening tool, but it is quite poorly sensitive. Right, so I'm going to show you a couple of scenarios through some case illustrations to indicate some of the principles that we've discussed. So here, for example, you've got tilapia fry. They are very tiny, they're small. All you sit with at home is you've got mortalities. Dead, tiny little fish, a couple of millimeters in size. What do you do with that? You cannot even with the naked eye see anything or suspect anything. You just see have death. So what you can do is you can pop these little fish in formalin, send it for histopathology, and lo and behold, and very often we can at least give you an idea, or and in this case a final diagnosis of a protozoal infection of the intestinal tract, which in this case is coccidiosis in these fish, and then we can treat the rest of the animals that's still alive in the correct way based on a sound diagnosis, and even take this a bit further to see if we can get to what the cause, underlying triggers may have been for this condition. Right, so in instances of fish kills, whether it's on farm fish kills or whether it's in nature, in natural dam reservoirs, this is, for example, multiple species that would have died. It's part of the history, which already gives you an indication of what you're looking into. So this is an example of a case where lots of fish species died suddenly following an acid mine drainage spill into the natural water sources. And we could, by using histopathology, support that suspicion, and by looking at the gills of these animals. So here we can see two sets of gills at different stages of injury. So here you've got an acute stage of injury where there's little cellular response, only you've got cellular death, so there's necrosis of the secondary lamellae, and this is a fish that survived a little bit longer, and there you've got a cellular response. So all the same insult, different morphological outcome, but with the right training and experience of the pathologist, interpretation will be made in such a manner. Right, so you can see also we cannot tell what chemical it is. There's no chemical signature that we can see. We just know that it's a diffuse change. It's likely to be a chemical exposure, and that can be anything from, in this case, it required then to analyze the water further for any noxious chemicals, which then came to the final conclusion of what happened in this case. So the pH of the water in this case was 4. So this is an important downfall, pitfall to remember, is we cannot see certain insults or causes, but based on the reaction of the tissues, we know what we can do next, or should do next. This is an example of bacterial gill disease, or Flavobacterium branchiophyllum, in trout mortalities, where the morphology of the organism histologically is characteristic, but it's not confirmatory. But at least now we know what we're looking for, and we can now take any additional specimens that may have been collected for molecular work or for a bacterial culture. Okay, having not had this, you would have been shooting in the dark, essentially. So in ornamental, so taking things to a different causality, here we've got ornamental fish with certain problems, lumps and bumps, and in the abdomen you see some mass formed, but you've got no idea. You've seen it for histopathology, and this is the kind of results that you can expect. In the abdominal mass you would have seen neoplastic conditions, so there's a cancer that is developing the intestine, and we can even subclassify this using further immunohistochemical tools. This is a discus species with a severe gastritis. There's inflammation of the stomach, and we in fact find the culprit in the act. These organisms that you see here is in fact Cryptobia species. So we've got cryptobiosis in a discus species, causing the cellular response and tissue injury as expected. So a very nice diagnosis made histologically. Laboratory fish, we've got an example here of a normal ovary on the left hand side, and as you can see, what I want to illustrate here is the morphological changes that anybody can really make. However, you need quite training and expertise to take it a little bit further than this, and in this case we would have done specific special staining to get to a result. So on closer magnification we've done Ziel-Nielsen staining, and these little red lines that you see in the cytoplasm of these macrophages are in fact Mycobacterium or TB organisms. So in this case we could make a diagnosis of tuberculosis, just extending it to a specific staining result. for histopathology. So sometimes we get cases where fish may have died of another cause, but we find significant incidental findings. In this case, we've got Ichthyopherius multifilus, which will be important for an owner to know for the rest of his fish. And in this case, all these little club-shaped organisms attached to the secondary lamellar surface, these are Ichthyoboda nicotrix, which is also going to be important for the owner to know about. So these can be secondary invaders in response to poor water quality, for example, but finding them tells us a specific story, and it also helps us with what to treat the animals with to get, in fact, not further mortalities. So what's the future for histopathology? We're certainly moving into the world of cell phone technology, where lenses have been developed that you can in fact go to a sub-macroscopic or to microscopic level, and remote consultation.
Hi there. I was going to say good morning, everyone, and it's just morning. So thank you very much for sticking around. I'm not nearly as famous as all the other people preceding me, so I'll try to stick to time. I just want to talk to you briefly about how we've used metabolomics to assess aquatic animal health in various aspects of that. Ooh, sorry, is Luke here? I don't know what I've done. Sorry. I pressed the button. Okay, cool. Which one do I move forward with? Oh, I'm at the conclusion, so I'm taking the message. Cool. So I feel a bit out of my depth after the previous speakers, because my world is very small. So there's a rendergram of a metabolic map that you've probably seen in each and every biology faculty is sort of where we play, and this really depicts different components of the intermediary metabolism, and we find the amino acid metabolism and fatty acid, lipid metabolism, etc., nucleotide metabolism, carbohydrate metabolism, all of these different pathways, enzyme driven, and mostly with the aim of cycling carbon through the TCA cycle in order to produce those reductive compounds that will assist in ATP turnover. So if ATP demand is adjusted somewhere in this complex cellular pool of different metabolites, we're going to have to find something to shuttle the carbon through the TCA cycle. And if that particular compound that you're wanting to metabolize, like the carbohydrates, are constrained, then you're going to have to shift to a different mode of providing carbon to the TCA cycle for ATP turnover. And so this is really where we try to operate at a broad scale of understanding how cellular energy allocation actually works. Oh, might have gone too fast. Metabolomics is really of interest to us because it is the closest we can get to the to what's really happening to the phenotype. And it integrates all those things from genomics and transcriptomics and proteomics. It sort of integrates all of the post-translational, post-transcriptional modification of all those signals that we see at those lower levels, and really shows what is actually happening at the cellular level in order to fuel the energy balance of the animal. So if you just want to strap on your seat belts and take note of the exits, I'm just going to fly you through metabolomics at a glance. So we're starting at the left. We would use different platforms: liquid chromatography, gas chromatography coupled to mass specs, nuclear magnetic resonance spectroscopy, and extract compounds from a sample. And those samples can be blood samples, plasma, tissue samples. We've done a lot of work on dry blood spots, where we extract those compounds and we identify through separating and quantifying and identifying the compounds, how many features we are seeing. So in this particular sample that I'm using here, we got about 1,400 compounds, unique compounds with known identity, with the known concentration. And we apply a filter just to make sure that if a compound doesn't occur in more than 50% of the samples, we just ignore it, because I mean, it's just a spurious feature that we've seen. We use multivariate methods, PCA, PLSDA, etc., to discriminate between our groups. And this is really one of the important things about metabolomics, is you use a two-sample approach. You compare your control with the treatment. Anything more than that, the methods haven't been developed to work at that level. So we use a control versus a treatment to see whether there are any differences. The next step that we do is to look at fold changes. And here we exclude compounds that have not been up or down regulated by a factor of 2. So twofold up or twofold down is deemed to be having a significant effect on the metabolism. And we pull in the statistical significance, and firstly with the fold changes we brought it down to 117 compounds, so it's a massive data reduction process to get to what is actually driving the metabolic differences that we see. And then we look at those compounds that are functionally important through the fold changes. If they're statistically significant, then we've come down to 42 compounds that is actually describing the difference in what we are seeing in 2 treatments. The other 2 aspects that are quite important are that, and I'm just going to stop there, I'm not going to carry on with all the other bits, is metabolic set enrichment analysis, the MSEAs that you see there, and the metabolic pathway analysis, the MET-PAs. And the output from the metabolic sets enrichment analysis is what I'm going to show you here. And it's sort of intuitive to understand how they work. You're really looking at 2 levels here, where the length of the bar shows you how significant that fold enrichment is, by how many times is that particular pathway been upregulated or downregulated, and the color is just showing you the significance of that at a statistical level. So we just scan through the top few pathways that were affected by this particular treatment. We can see that galactose metabolism was affected greatly, fructose, mannose, and we can work down and see that a large number of carbohydrate pathways were significantly and to a great deal affected by the treatment that we used here. And then if we just scroll through the other top affected pathways, you see that amino acid and ammonia turnover was greatly affected by this as well. So this is how we sort of eventually tried to piece together what the metabolic consequence was of whatever that insult was. And I'm talking vaguely here, so I think I'll try to go to some specific case studies. And the ones I put up a few here in the interest of time. I think I'm going to cut down on the numbers that I'm going to talk about. So the first work that we did was on growth rate. So the question was, if you have a cohort of animals with limited parentage, they were spawned at the same time, treated the same way, same season, everything is very similar. The genetic signal should be relatively small, but as a farmer you see these differences in growth rates, and that you can see graphically. And if you're a fish farmer or abalone farmer and you see that sort of variation in growth in your system, it's quite problematic, because your projections on growth and income, etc., fulfilling orders, it becomes quite difficult. So is it possible to understand what that signal is? And we went through the whole process that I flew you through previously, and we tried to put together a metabolic map. And pardon the rendergram again, but it basically tells us, try to put it in the red arrows, is that we, yes, carbohydrates are driving a lot of carbon flow through the TCA cycle, but we get a huge input from amino acids that is not necessarily associated with growth, because if you look at the growth factors, they are really insulin based and they mobilize carbohydrates for growth. But we see here a huge contribution of amino acids to fueling protein synthesis, which equates to growth. So what did we do with this? When understanding how these pathways are shifted in the fast growers, we formulated specific additives to abalone feed and to fish feed separately, and we trialed that on farm trials on abalone farms. The improvement was incredible. So we've got proof of concept on the fish side, and the next step would be to trial that out and at a sort of semi-commercial scale to see if all these benefits that we see can actually be manifest at production levels. So we utilize this information in order to improve the farming process. The other thing that I just wanted to touch briefly on is anesthesia. Now, anesthesia is a welfare thing. We apply anesthesia when we handle animals to reduce the stress associated with that, because with stress, as we heard in some of the previous talks, there comes susceptibility to parasitic infection, etc., etc. So we want to decrease the stress associated with these interventions. So ideally in anesthesia, you would want to put the fish under in different levels of anesthesia, going deeper and deeper to different planes, ultimately to the surgical plane if that was needed. We want to maintain them there for a while, and then we want them to recover and resume normal behavior. And I was very interested in this and in interpreting what we're seeing, because I recently had an operation, so I really wanted them to put me under and bring me back to the same way I was before. Not that that's an improvement, but yeah, you can hope. But in this process, we can lose the fish through overdosing. So if we don't apply the correct anesthetic at the correct level, we can overdose and we can kill them. If we dose, then we run the risk of not reaching the stage of anesthesia, so pain can still be felt, and fish have been shown to have a definite pain response. So in terms of what I've just shown you on these metabolic set enrichment analyses, you can already determine that the top two anesthetic responses induced massive shifts in the intermediary metabolism of these fish. So the act of doing something for their welfare was actually inducing a massive impact on them. And if you look at the type of responses, we put together the pathways for this. The first one is really challenging the stress responses, and is really pushing energy into fueling an acute stress response. The second one was associated with impacts on the NMDA receptors, and was fueling a complete response associated with that. And the third one had minimal impact on the intermediary metabolism. So if your purpose was to anesthetize fish to sample them for the work that we're doing on the metabolomics, it means that if you are using anesthetic number one, the mere act of you using that anesthetic is making you measure something that is not representative of your treatment, but is a representative of the anesthetic that you applied. So this is really fundamentally important data, because we worked on zebrafish, and they're used for so much translational research on human diseases. So many disease models are being researched in zebrafish. So if you are anesthetizing the fish and they are showing this response, there's no way that you can translate that into a medical application, because you're measuring something really bogus. Just for interest, the bottom anesthetic is clove oil, and the top one is MS222. It's known for its aversive reactions that it induces in fish. So we are working on an amended protocol to try and ameliorate some of these responses, and looking at the anesthetics themselves to make sure that they have proper anesthetic and analgesic effects. And we are likely going to use a protocol in combination to put the fish through different combinations of anesthetics to achieve that desired state of anesthesia and analgesia with minimal impact on the intermediary metabolism. So in conclusion, I think I'd just like to remark that the protocol that we followed and the methodology that we follow is applicable much wider than fish and abalone that we've used here. And the reason is that intermediary metabolism map is so consistent, so conserved across several species, that the applications outside of this group that we spoke about are definitely there. The beauty of metabolomics is that we analyzing what's actually happening in the animal and not inferring based on some mRNA transcript that may be never come to expression. The workflow is robust, we're getting really strong, good results, and we're not basing an entire assumption on the response of one metabolite, like measuring glucose in fish. We're getting the full picture of all the pathways that are affected. Sorry, just the last ones. The metabolic profile that we have in the fast growers allow us some opportunity for interventions in the feed formulation, and we've shown that that works. We've worked on parasitized fish, and we get some general signals, and we get some specific signals, so there's lots of potential for biomarker development. And I think I'd just like to end with a request that people who use anesthetics in fish just be very careful about how you go about that. And I think just before the trap door opens, I should say thank you and step aside. Thank you very much, everyone.
You certainly undersell yourself. Thank you very much for a fantastic presentation. Are there any questions? Yeah, don't leave too soon. Any questions for Andre? Okay. Unfortunately for the online audience, we don't have anyone here monitoring those questions, so there might be some that we'll come back to you with later.
I'll also use beer equivalents. If you have any questions, meet up with me and give the token, and I'll chat to you about any of these aspects.
Okay.
Thanks.
Thank you. Our third speaker in this session is for diagnostics and aquaculture is Dr. Mariska Loubser. So I met her last night. And with a true love for science, diagnostics, and natural environment, it says, and that includes our massive electric magnificent storms, which we were able to present her with last night. So after completing a joint BSc degree, so microbiology and zoology at Northwest University, she followed the traditional academic career. She had successfully completed a PhD degree, environmental microbiology at Stellenbosch University in 2016, and her postgrad studies have allowed her to make significant contributions to the sciences. So she's currently employed at Lancet Laboratories as a molecular scientist. With her thorough background in sciences and extended experience in molecular assay development, this has positioned her well to be the responsible person for on-site validations for most molecular assays. Due to her experience in aquaculture disease screening, she was able to initiate, establish and monitor a veterinary diagnostic department within Lancet Cape Town. And the main focused drive and impetus of the department is on aquatic invertebrates. She envisages this specific department to include diagnostic services to invertebrates, and her ultimate goal is to network, collaborate, and branch out into other various disciplines.
Forward, back, laser. That's fine. I'm going to be quick. Thank you for that introduction. Hello, everyone, and thank you for the opportunity. So, like you've heard in my bio, I'm from Lancet, and I'm just going to talk a little bit about diagnostics in aquaculture. So, what is a diagnostic assay? So, the purpose of a diagnostic assay is to detect a causative agent or a pathogen or whatever you're looking for. So you're looking for an assay that's going to be able to detect that. And that can be done in various ways: microscopy, culturing, immunoassays, and then also molecular. So there's two things I want to discuss a bit today, which is the diagnostic assay validation, and that's the part that gives you confidence in the assay that you are using. And then we're also going to look at the quality assurance. So quality assurance is the part that always gives you confidence in your results. Okay, so diagnostic assay validation. The World Organization for Animal Health, defines it as a process that determines the fitness of an assay for its intended purpose, and it helps to determine analytical and diagnostic performance characteristics. So basically what this means is, how fit is your assay to do what it's meant to do? So every sample that comes into the lab, in theory, has two potential outcomes. It can either be positive or negative for whatever you're testing. But in practical, there's 4 positive outcomes. There's a true positive, a true negative, a false positive, and a false negative. So obviously we want to use an assay that's going to lower your risk to have false results. So you always want an assay that will ensure that you get your true results. If I can explain this a little bit easier in a more day-to-day example, is if we look at fruit for an example. So if you would be looking for a green apple in the first bowl, fruit bowl, it would be very easy to find it, right? Because it's the only apple, or maybe one of 2, but all the other fruit look a lot different. So it's not that difficult. If we go to the second one, there, now you've got apples and apples. So it's a little bit more difficult, but still, if you were to pick a red apple now, that would be a false positive. And then also there's the possibility to detect that apple, which is half red and half green. Again, that would be a false positive. And then the other scenario that we can have is the last one, which is also a green apple, which you would want, but it could potentially be missed because it's covered in something. So to take this back to diagnostic assays, you want an assay that would be able to detect your pathogen no matter what it's coated in, no matter what it's worth, and no matter what other chemicals are with it. Then let's look at quality assurance. So right, now you've got your assay validated, but when you perform your assay day to day in the lab, there's a couple of things that can change, and this will obviously influence your results. So you can have environmental conditions changing, you can have system failures, you can have different operators. If you're in South Africa, we're all familiar with load shedding. So these are really things that can affect your results. And to avoid this to impact your results and to ensure that you can still trust your results, you need appropriate controls. So I want to explain it this way. What is an appropriate result? Control, sorry. So let's use this passage as an assay. The end of the passage, the white rectangular, would be seen as your result. And then each door represents a step in your assay. So if you would be following through your steps to perform your assay to get to a result, and any one of your controls would fail, in that case, or for this example, that door will be closed, which means you are unable to see the end of the passage. In that case, you cannot trust your results. So unless all your controls passed, you cannot trust your results. Another very important part of quality assurance is repeatability. So yes, we are all just people in the lab, and none of us can work 24/7. So yes, we've got multiple operators, we've got multiple pipettes, instruments, and all of that. So you have to ensure that you're always going to get the same result, no matter what other variables there are. Another one, accuracy and precision. Too far. I think we need a new battery in here. There we go. Okay, accuracy and precision. So this is very important because you can have high accuracy and no precision. So that might mean that you get close to your result, but it's not repeatable. Or you might have high precision, like this bottom one, but no accuracy, in which case you'll have repeatable results, but that doesn't mean that that's true to the true value that you're looking for. And this is why it's very important to always make sure that you've got a positive control included to ensure that your repeated result actually aligns with what is the expected outcome, the positive. So we're always looking for the highest accuracy and precision. And then if all of this is in place, then you can have confidence in your results and not only in the assay that you're using. So this brings me to the next slide, which is why I'm here and the very exciting new department that we started in Cape Town in Lancet. So who is Lancet? We've got 9 reference laboratories across the country. originally, most people know it for human medical diagnostics, but like I said, we've just started with the aquatic diagnostics. We've got a large footprint in Africa. We've got a variety of specialized pathology services. Thank you. Can you go back one? Thank you. We've got a strong relationship with VDX that's been standing for years. We are an accredited laboratory, and then, like I said, we've got the new department in Cape Town that's specifically focusing on aquatic diagnostics. Who are we in the team? So myself, founder and molecular scientist of the department. I've got over 10 years of experience in diagnostics. Dr. Justina Voyner, who's a pathologist and microbiologist with over 20 years of experience. And then we've got Mushfika, who's our technical assistant. So at the moment, we offer molecular diagnostics. We screen mostly for the OIE listed diseases, and we've recently added the norovirus, genotype 1 and 2 to our scope. We do also offer sequencing if that is requested. We can also offer microbiology servicing, culture microscopy, identifications through MALDI-TOF, antibiograms to determine sensitivity. One of the cases that we were involved with, our lady in red teenager at the Two Oceans Aquarium, obviously under the supervision of a vet, I went to take samples. We cultured it, identified a couple of bacteria, did antibiograms with drugs that they wanted to test for that specific bacteria, and obviously they could make an informed decision based on what to treat with. So yeah, that's my story. And to end off with, I would like to invite all of you, if you've got anything that I can help you with, please come and talk to me. Like I say, we are in our baby shoes, but we are ready and excited to be of service to this industry. Thank you.
Thank you, Mariska. Very exciting, and I think it's going to be helping a lot of people in aquaculture. So, yeah. Any questions for Mariska before we move on? Again, unfortunately, we don't have the online questions available now, so there might be some questions later on. Thanks. Our next speaker is Vernon Coyne, and he is going to speak on the use of biomarkers for monitoring chronic stress in farmed abalone. So Vernon obtained a PhD from UCT, was a postdoctoral fellow at Georgetown University, Washington, D.C., and a research assistant professor at the Center of Marine Biotechnology, University of Maryland. He is currently an associate professor in the Molecular and Cell Biology Department at the University of Cape Town and a co-founder of Mary Health Solutions. His research applies marine biotechnological solutions to the aquaculture of marine animals.
Okay, so I assume everyone can see the slides.
See them?
Okay, can I carry on?
Yes, please do.
Okay. All right, thank you very much for the introduction. I'll just get going then. So I'm going to be talking a bit about our work that we've carried out on developing biomarkers for monitoring chronic stress in farmed abalone. And I also would just like to take the opportunity to introduce Sarah Carroll, who's my colleague and co-founder, who's responsible for a lot of the work that I'm going to present. Right, so just by way of introduction, obviously we are all aware of climate change and the effects it's having worldwide. And here's the pointer here. And the issue is that, and I think a lot of speakers that have come up previously or earlier have alluded to the fact that obviously in the farm situation, animals are stressed, and as stress increases in animals, they become more susceptible to disease and infection, and climate change doesn't help the situation in the slightest. So since the Industrial Revolution, we've seen an increase in ocean water temperatures going up about 0.2 degrees Celsius every 10 years. We've also seen a decrease in pH of the ocean. where we are expected to see the pH decline by about 0.4 units by the turn of the century. And although this sounds like a very small number, it's important to remember that pH is measured on a logarithmic scale, and so these changes have a very dramatic effect on the survival of animals that rely on particular pHs in order to survive. And here you can see in this series of photographs a pteropod that had been subjected to water pHs which are expected to occur around the turn of the century, and you can see within 45 days its shell has been totally degraded, and that's because the drop in calcium as a result of the increase in CO2 in seawater results in reduced growth rates, reduced development, and reduced survival in calcifiers in animals that have ectoskeletons. So Andre earlier spoke a little bit about biomarkers in terms of metabolomics and metabolites. What we look at are also biomarkers, but we are making use of particular proteins which we can measure in terms of their levels in an animal over time, and from that determine what these functions are, and therefore what levels of stress are occurring in these animals over a period of time. So what we do is, and I'm going to just give you the case study based on abalone, but I just want to stress that we are now also working in fish farms as well. So this is applicable to other species besides abalone. But what happens is we go to farms, we take blood samples from animals, so we don't need to sacrifice animals at all. We subject these to mass spec analysis. We take them through a pipeline of various bioinformatic analyses. I'm not going into all kinds of details. I think Andre did quite a good job in that regard. And from there, we are able to identify biomarkers based on their levels of expression as well as their particular functions. And the idea is to develop suites of biomarkers which can be used as an indicator of stress in farmed animals, and in particular identify what those stresses are in order to alleviate those stresses timelessly, and therefore to lessen or lower the chance of infection and therefore stock losses down the line. So the data from this is to be used as a foundation for a health monitoring scheme which is proactive rather than reactive, which is what happens currently. People wait until they see dead and dying animals on a farm, they then call the vet in, and then they basically come up with a diagnosis. And I think earlier when we heard the talk by the farmer, the fish farmer earlier, that by the time they knew what was wrong with the fish, they had already undergone a large number of losses in terms of animals which they couldn't really afford to lose. So here is a volcano plot showing a comparison of proteins which are upregulated or downregulated in response to pH stress. So I'm focusing purely on pH stress for the sake of this talk, but it can be any kind of stress or any kind of stimulus. And from this type of analysis, we can identify proteins which are these dots over here. So the red dots are showing proteins which are upregulated compared to animals which are not stressed. And in this case, these were animals that were not exposed to a reduced pH in their tanks. And we can then quantify these proteins in terms of fold upregulation. So anything above 1 is at least 2-fold or more upregulated. The blue dots indicate proteins which are downregulated. These proteins then can be identified and further interrogated in a qualitative analysis, to place them in various categories based on their functions. So again, just like Andre showed for metabolites, we can show the same type of thing with proteins. And from this, we can see that there were 4 main groups of proteins that were highly upregulated and were obviously enriched in terms of what we saw for the other functions. And these are proteins that were mostly involved in producing expressing proteins, and reacting to changes in the environment, as well as signaling from the cell surface to the nucleus to induce expression of various proteins, which are important for allowing these animals to withstand this oceanic stress, acidification. And we saw a huge increase in proteins involved in the cytoskeleton, in its structure and its function. From here, we moved on, and we placed these proteins into what we call protein-protein interaction networks in order to allow us to further identify functionally related proteins. So we are able to whittle down the number of proteins to 29 potential biomarkers, which could potentially play a role in allowing the abalone to survive ocean acidification. And these proteins that are shown here in various colors indicate proteins which are upregulated by at least 20% compared to unstressed animals. And we can place the position of these proteins within the cell in terms of the cytoplasm, or whether they function in the endoplasmic reticulum, and whether they're being expressed in the nucleus, to identify what they possibly are doing. And the next step in this was to then place these proteins into particular pathways using Reactome, which is an online bioinformatics tool. And we saw proteins that played a role, a number of proteins in fact, that played a role in phagocytosis, which is generally it's a major component of the invertebrate immune response, in the innate immune response. So it's a way in which invertebrates engulf and get rid of pathogens, and so we see this happening mostly in infectious diseases, but we also saw this being upregulated in animals that were exposed to acidic conditions, water conditions. So we saw proteins that played a role in neutrophil degranulation and phagocytosis, and a number of studies have now on marine invertebrates have basically reported similar results. And it seems that what we are seeing are phagocytosis of dead or damaged hemocytes, so blood cells, and the engulfment of these, probably due to ocean acidification. We also saw a number of proteins which are upregulated in response to various stresses, such as changes in the extracellular iron concentrations, basically hypoxia and elevated water temperatures. And it's important to realize, and for me to just point out, that many of these proteins talk across various stress response systems in these types of animals. So these proteins that we identified here are generally responding to increased oxidative stress due to increase in reactive oxygen species as a result of ocean acidification. And what we think is basically happening here is that there's a general cellular response to stress, which is most likely associated with the hemocyte degranulation phagocytic activity that I mentioned earlier. And then finally, we've also identified a large number of proteins which are upregulated, which play a role in signaling to the cells that they are undergoing various stresses. So the Notch signaling pathway regulates cell differentiation proliferation. The signaling by Wnt pathway regulates intracellular calcium. It regulates cytoskeleton structure and transcription of proteins in the cell. The MAPK-ERK signaling cascade plays a crucial role in transducing receptor signals to the nucleus. It plays a role in regulating cell proliferation. It is also a key pathway which is affected by cellular stress responses. And then proteins involved in the Rho GTPase signaling pathway are known to be essential for cytoskeletal structure and cell motility, such as the formation of pseudopodia during phagocytosis, while also being involved in vesicular trafficking. So this is just to give you an idea then of the type of analyses and information that we can get out of this type of work. And in the end, we were able to show quite an intricate model of how ocean acidification affects both the cell cytoskeleton and from their effects in metabolism in the cell, in this case switching the cells from aerobic to anaerobic metabolism, so it obviously would affect growth in these animals, and it also induces a whole cascade of signaling which all talks to the innate immune system of these animals, and as a result affects a range of various responses such as inflammation, phagocytosis, which I've mentioned already, apoptosis, and prophenyl oxidase cascade, which induces myelinization. And obviously in the end, all of these issues affect cell proliferation and will affect growth. So just to summarize then what I've talked about, in terms of this particular case study with abalone, we've shown that a number of signal transduction and cytoskeletal proteins are upregulated under ocean acidification stress. Some of these proteins are also involved in phagocytic-related activities, which in other marine invertebrates have been associated with stress response. And the work that we have been doing has both real-world relevance as well as application. In terms of relevance, it obviously provides a greater insight into the molecular stress response of abalone under changing environmental conditions, particularly in light of climate change. And the application of all of this is that it's going to basically provide us with a tool which will allow the aquaculture industry to revise their practices as we go forward and as climate change becomes worse and worse over time. And clearly this is going to happen because we haven't responded quickly enough to this issue. And by being able to monitor chronic stress in farmed animals, we can hopefully be able to reduce significant stock losses and ultimately ensure the sustainability of the industry. And so just by way of ending, I just want to introduce Marry Health Solutions to you. This is a new spin-out company which was launched a year ago from the University of Cape Town, and it is based on the biomarkers that I've been describing to you now. We have a number of candidate biomarkers which are specifically responding to various inputs, such as probiotic supplement feeds, which increase the growth rate and disease resistance in farmed abalone. We found biomarkers which respond to bacterial infection in farmed abalone, as well as biomarkers which mark the effect of acute temperature stress and decreased pHs, which I've talked to you about now. And the company has just finished sampling 2,000 animals out on 2 different abalone farms, which are separated at 2 geolocations across the Western Cape, one on the west coast, one on the south coast. And we've done this work over 2 seasons, summer and winter, for a period of 2 years. And so the data obtained from this study will obviously expand the suite of biomarkers that we will have available to abalone farms to monitor chronic stress, as well as use this as a tool to tweak their farming practices in order to improve farming and deal with issues that may arise on the farm. And then finally, I just want to introduce once again Sarah Carroll, who's a co-founder of the company, and various people that have helped keep this company going. And I would like to end there, and thank you very much for your attention.
Any questions? Any questions for Vernon, or can we go on with the next speaker? Thank you very much. Our next speaker doesn't need, she's put breathless, rushed in, so she doesn't need too much introduction because we've been talking to her and about her for the last day, couple of days. So Gillian, thank you very much.
Thanks. My brain's in a whirl, jumping between tilapia biosecurity and now into histology. No, it's fine. So yeah, this presentation I've titled Correlations Between Gill Histopathological Markers and Ectoparasite Burdens in Wrasse Farm Tilapia Oreochroma species in the northern provinces of South Africa. So it's just a little snippet that was born out of my research through the tilapia farms. We just found some really pretty interesting histological changes, and so that really this is just sharing that with you. So just an overview of the research study. So we surveyed health in 19 tilapia farms, looking at, we targeted the juvenile grower group between 100 and 250 gram fish in the grow-out systems. We used a targeted sampling technique, targeting any fish that maybe perhaps didn't look as healthy as the rest, but saying that we didn't really see much evidence of that. And we sampled 10 fish per farm or per site. They were euthanized through rapid chilling and decapitation, and we employed that method because we wanted to not compromise our ectoparasite loads on the fish. The fish were then examined on farm with direct light microscopy to assess the ectoparasite loads, and we then sampled multiple organs inclusive of the gills, collected and stored in 10% buffered formalin and transported back to Ornisdepot for histological evaluation. So one of the things we looked at then was the ectoparasite load on the fish, and so not only did we identify the key species that were prevalent, but then we also decided to try and score them as well, which was laborious. So we counted parasites under magnification on each gill section. So basically we looked at, your motile ciliate groups, we looked at monogeneans, sessile ciliates, parasitic flagellates. Those were the groups that really we found evidence of, in particular Trichodinus species as a motile ciliate. We did not see any Chilodonella or Ichthyopteris. Monogeneans, yes, there was evidence of Dactylogyridae, Gyrodactylidia species. Within the sessile ciliate group, we found Ambifraia, one Epistylus case, and within the parasitic flagellates, Ichthyoboda Necato complex as well was prevalent. So then we just developed a scoring system with the motile ciliates, numbers per 100 times mag, and we graded them at between 1 to 5 in terms of severity. The monogeneans graded 1 to 4, counting them under a 40 times magnification. The sessile ciliates numbers per primary lamellum and graded them between 1 to 4, and the parasitic flagellates numbers on a 400 times magnification. And just saying that, those were assessed on histological assessment. I'm just trying to remember how we did this. So the first 3 would have been assessed on your wet preps, and the Ichthyoboda was on histological counting. Then in terms of looking at gill histopathological findings that we found, the key findings that were prevalent through the farms was epithelial hyperplasia, goblet cell hyperplastic change, infiltration of the eosinophilic granular cells, particularly at the base of the primary lamellae, and then evidence of lamellar fusion as well. So we scored all of these histological changes again with epithelial hyperplasia between 0 to 5. We counted a 0 as normal, goblet cell hyperplasia 1 to 5 with 1 as normal, EGC infiltration 1 to 5 with 1 as normal, and lamellar fusion 0 to 3 with absence of fusion counting as a 0, and generalized widespread fusion as a score 3. I've just put a description of really what those changes are, but epithelial hyperplasia is essentially, we assessed it, we're looking for things like epithelial layer expansion, euchromatism, and fusion of the lamellae. The goblet cell hyperplasia, we identified that as an increase in goblet cells, and we counted them per 5 interlamellar spaces. The EGCs, we counted those at 400 times field, and used that to fit in within the scoring system. And then the fusion, as I say, it was either non-focal, multifocal, or generalized. So these are just some images of the different kind of scores that we found. So starting with so we're looking at lamellar epithelial hyperplasia, starting with a grade 0, moving to a 1, 2, 3, 4, and 5 in severity. And then looking at our goblet cell hyperplasia, starting as a grade 1, 2, 3, 4, and 5. So, I mean, it's quite difficult to see, but obviously a healthy gill over here. So we're looking for numbers. So you can see there your goblet cell. So it is a little mucus cell. They look kind of purpley white. on your primary lamellae. So you can see extensively here in your grade 5, there are multiple kind of clumps of these goblet cells here now accumulating, together with the epithelial hyperplasia as well. And there's a little trichodina as well, just sitting in between the secondary lamellae. Then looking at the EGC infiltration. So these are now sections at the base of your primary lamellae. So that's a primary lamellum sticking up there. There goes another one there. So this is at the base where they're attached. So your EGC cells, or EGCs or EG cells, are these kind of red cells. So they're filled with little red kind of granules in their cytoplasm. So there we've got a nice gill section with no evidence of EG infiltration. We're starting to see a few of them dotted around there, multiple now appearing there, increased prevalence now, and really, really severe infiltration of EG cells here at the base of the lamellae. And then these are just some images of fusion, or examples of fusion. So again, a gill section with beautiful gills with absolutely no signs of fusion. There we've got a focal lesion there with our secondary lamellae now showing signs of fusion. I describe this as a multifocal. Well, you can't see all the gill sections, but it wasn't widespread and generalized through everything. But there, your secondary lamellae are evident, and you can see they're embedded in this, hyperplastic reaction essentially. So it's a focal epithelial hyperplastic reaction that we're seeing happening there. And then here we've got multiple primary lamellae here, and you can see, multiple of them are affected, and you've got severe areas of fusion, loss of your secondary lamellae, and significant loss of your surface area. So there's a little focal epitheliocystis pathogen lesion as well, which is incidental, but we did see a bit of that as well in our sections. So the results were just interesting, and I possibly pose more questions than answers at this stage. But we, between all these fish now, so it was essentially about 200 fish through the whole study, we saw widespread low-grade epithelial hyperplasia. It was a common finding amongst fish, but most of them were kind of fairly low to moderate grades. So nothing really, most of them were not the grade 4 to 5, but 64.3% of the sample population were showing hyperplastic changes. And then what we did is we tried to draw statistical correlations now between, we looked at the histological changes and tried to correlate that with water parameters, and then we also looked at correlations with parasites. So the water changes didn't show anything significant, and they're difficult to assess because it was a one-off water sample, and the history of the last 2 weeks of water changes on the farm can have impact. So there was a bit grey area, but we found some interesting correlations with parasites. So significant Pearson correlation between the lamellar epithelial hyperplastic change and trichodina species. So we believe this most likely to be ascribed to the direct mechanical injury from the feeding action and the attachment of the high numbers of these parasites. So they've got kind of little suction bodies in the middle, and as they migrate around and browse on the mucus, they can really have quite a traumatic impact on the mucus on the little gills. And by inference as well, knowing that a number of water parameters predisposed to trichodina as well, you can draw an inferring connection as well there. The goblet cell hyperplastic change followed similar correlation relationships as the epithelial hyperplasia as well, also showing a significant correlation with trichodina species. And the pattern we really saw with trichodina is that it triggered a triad of pathological changes. So you got this epithelial hyperplasia developing, goblet cell hyperplasia seeming to happen as well, and together with that, the EG cell infiltration at the base of the gills. We also found a positive correlation, a significant one, between the epithelial hyperplasia and the EG cell infiltration at the base of the gill arches. A similar positive correlation between goblet cell hyperplasia and the EG cell infiltration at the base of the gill arches. What was quite interesting as well, we found a significant correlation between the goblet cell hyperplasia and the sessile ambifraea. But interestingly, ambifraea, as a sessile parasite, didn't seem to elicit or show any significant association with epithelial hyperplasia. It seemed to trigger more of a goblet cell or mucus cell reaction on the gills. In terms of Ichthyoboda necator, what we previously used to call Costia as a parasite, we couldn't draw any association between that and any gill pathology. There was an interesting negative correlation between the average Ichthyoboda, Costia, levels and Trichodina levels. So there seem to be two parasites who actually don't like cohabiting. So in summary, your epithelial hyperplastic change seems to be primarily associated with the mechanical effects of high Trichodina burdens, and by inference, their predisposing stresses, and seems to always form part of a triad of pathology in the gills. But your ambifria seem to elicit purely a goblet cell response rather than epithelial change. So these are just some images of the parasites for those of you that are not familiar. So there, at the top, along the top, those are all just wet mounts of ambifria. So you can see the little parasite there. So it kind of attaches onto the gill, or these are in the mucus, and it has like a little collar, corona of cilia. So it just feeds in the water body, but it actually firmly attaches to the gill. There's the edge of the primary lamellum. And on the bottom, we've just got some wet mount images of Trichodina. Sorry, it's a bit pale, but little UFO type ciliate, very motile, and there it is just gliding around and feeding on the outside of the primary lamellae. So hypotheses on the underlying mechanisms happening here, and as I say, more questions than answers. So we know that goblet cells they're believed to be part of the immune cellular triad of mucus, rodlet, and EG cells within the gills and within the body of fish. We know they secrete a glycoprotein-rich mucus, which contains humoral immune factors with biostatic and biocidal properties, and they respond to increased microorganism or parasite levels. So perhaps, because of ambifria's mode of attachments, its propensity to multiply rapidly on fish, maybe eliciting or together with concurrent localized secondary bacterial disease, maybe that's the reason we're getting more of an immune reaction with the ambifria. But Trichodina, its lack of association with the goblet cell proliferation, maybe that reflects more of a symbiotic relationship with the host fish, and ambifria more pathogenic, question mark. Yeah, so EG cell infiltration definitely showed an indirect link with the high parasite burdens, and we know EG cells are also part of the immune function in fish, but they're believed to be a second line of defense. So but when a gill or a fish is challenged by some kind of immune stressor, it's believed that you get this initial mobilization of mucus secretion, influx of rodlets, your goblet cell, rodlet and epithelial cells, and then your EG cells are believed to come in as a second line of defense. The high correlation at the base of the gills, well, we know many parasites, particularly your monogenes, also tend to hide down kind of low very often at the base of the primary lamellae. Are they playing a role? We did find monogeneans, but we couldn't draw, a significant correlation between them. But yeah, reflecting and looking at the epithelial hyperplasia and the goblet cell hyperplasia, potentially if you're seeing those changes, you could use it as a measure of the level of immune challenge on the fish, or an indicator of both acute and chronic tissue injury in the fish. And that's it. So as I say, I think it's opened up more questions than answers, but there were some quite interesting little findings that we found. So thank you. Any questions? Yes, John.
Is that okay? Thank you very much for that good presentation. And these are common parasites that we find in systems. Would you say the epithelial hyperplasia will be more prevalent in juveniles? Did I hear that properly? In juveniles than adults or something like that?
No, we sampled, they were largely the juvenile adults, so no. But I mean, from my perspective as a vet looking at older fish, almost harvesting stage, and fingerlings, Trichodina seems to be widespread. I wouldn't say it targets any particular age group at all. I think once it's in a system, or, it seems to, as I say, my impression is it's almost symbiotic, and the fish can cope with low numbers, but as soon as your system's out of balance and your water quality parameters are unhappy, which they certainly were within many of our systems, then the fish are stressed, and then these parasites start proliferating. So I think that seems to be the pattern I often see. And once the trichodina proliferates, then when the numbers are high enough, you get the secondary gill damage happening then. So, but it's by far our biggest tilapia parasite problem.
Yeah, we've seen this so much in cage environment, fish that is within the cages, where you find a high load of trichodina than in ponds.
Yeah. And I think also, with intensive systems, your fish are close together, so it's that much easier for parasites then to, jump hosts as well. So it all just predisposes to a parasite population burgeoning. But it's always good then to go back and say, why? Why are the numbers so high? And certainly look at water quality and then all those underlying stresses. I suppose nutrition then comes into play. Overstocking of systems comes into play. You'd have to look at the whole thing quite holistically and see, what factors are predisposing to it.
Any other questions?
Okay, there you go.
Thank you, Gillian. Okay, we're going to break for lunch. For you. We're going to break for lunch, and the next session will start at 22:02, so 13:40, which gives you, almost an hour. of aquatic diagnostics, and Dr. Essa Suleiman is now going to be speaking. Dr. Suleiman is a CSIR principal researcher and the research group leader for veterinary molecular diagnostics and vaccines. He holds an undergraduate degree in microbiology and biotechnology from the University of Cape Town and a PhD in microbiology from the Nelson Mandela University. Prior to joining the CSIR, his research focused on molecular disease epidemiology of important veterinary and zoonotic diseases in wildlife, which I find very interesting. His current research focuses on developing a lab-on-chip point-of-care molecular diagnostic platform which combines microfluidics, isothermal amplification, and mobile fourth industrial revolution technologies to enable point-of-care diagnostics for diseases affecting human, animal, and environmental health. And I must say, that's probably one of the most difficult sentences I've ever read. His research also focuses on novel diagnostic technologies for COVID-19. Sorry about this. Didn't see it went over to the rest of the page. Okay. He's also driving the veterinary vaccine program, including the development of plant-produced and mRNA vaccine technologies for veterinary and zoonotic diseases.
Thank you.
Thank you very much.
Thank you so much. Good afternoon, everyone. Okay, so thanks for the invitation, and I'm going to talk about development of novel diagnostics technologies for tilapia lake virus and ISKNV. But maybe just, okay, to give a little bit of background around the CSIR. The CSIR, maybe some of you know, is a state-owned enterprise, and part of it's a Council for Scientific and Industrial Research. And part of our mandate is developing novel technologies for a variety of applications. And in the vet space, so we have different research clusters, research groups, and the Veterinary Molecular Diagnostics and Vaccines group focuses on a One Health approach to disease diagnostics and disease surveillance. We have a program for development of vaccines, program for development of diagnostics, and then a program for veterinary medicine, and I'll try and cover some of these. And really it's around developing novel technologies that are of relevance to the local industry. So we're very industry focused rather than being more research and academic type focus. So CSR is very, very industry focusing. I'm just trying to find the pointer. Okay, so I think many of you are familiar with this particular diagram. This is a One Health sort of approach to disease, where environmental health, human health, and animal health are three sort of parts of this Venn diagram, and disease is in the center. And we believe that diagnostics is an important part of that. If you can't diagnose a disease, then treatment and management of that disease becomes very, very difficult. So again, CSR, because it's an organ of the state-owned enterprise, we are very closely aligned with various government policies and legislation, particularly the bioeconomy strategy, the DSI's decadal plan, as an example, the economic recovery plan, etc. And really it's around, again, developing technologies that will enable industry to function better and better capability of the state. Again, just an example of how we fit into the agri-bioeconomy. We have various programs in terms of aquaculture, agro-processing, food safety and nutrition, capacity building, training, precision agriculture. All of these speak towards the agri-bioeconomy and other programs from DSI. And broader programs such as the recently launched National Biosecurity Hub. So maybe you've heard of this. This is the vision of the hub is to be relevant across all agriculture and forestry sectors, significantly increase the capacity available to the SPS regulatory authorities of South Africa. And basically this is where CSR is a partner to the Biosecurity Hub and providing support in terms of veterinary and human health. some of our existing programs and projects that we have in relation to the biosecurity hub and animal health. We have various programs in terms of developing vaccines and diagnostics for FMD, avian influenza, a point-of-care diagnostic for FMD that has been spun out and licensed to a startup company, Tokabayo, and then ABIP support in terms of developing aquaculture diagnostics and supporting the local industry and African and partners across the continent. So this is where I'm going to talk now a little bit more about the tilapia lake virus and ISKNV diagnostics, and I think we're all familiar with this. The aquaculture industry is growing. Tilapia is worth about 7.9 to 12.8 billion per annum. The most currently produced species is Nile tilapia that accounts for the majority of production. I think this has been covered already, that aquaculture production, particularly for tilapia, is growing exponentially and exceeds capture production significantly. And it's an annual growth of about 2 billion an annum. But one of the some of the challenges is related to disease and disease diagnostics. So tilapia lake virus and ISKNV are two particularly important pathogens. They both have very high mortality rates, and there are significant socioeconomic impacts with outbreaks of these particular viruses across the African continent. So Egypt experiences losses of about 100 million annually, and about production losses of about almost 100,000 tons. And in sub-Saharan Africa, at least about 6 million jobs directly and 18 million livelihoods indirectly are affected by TILV and ISKNV outbreaks annually. And also in SSA, greater than 400 million lives may be affected by food insecurity due to TILV and associated losses of about $3 billion. So significant problems to the industry. And one of the major challenges is that, again, with TILV and ISKNV, if you are a farmer or have a production farm, you can't really just go out and buy a diagnostic test for TILV and ISKNV. It's a bit of a challenge. And again, the second challenge is around treatment. There's no really treatment options to manage TILV and ISKNV outbreaks. And CSR, as an organ of the state and as part of our mandate of developing technologies and licensing out these technologies to industry, have developed novel diagnostic assays for detection of TILV and ISKNV. And these assays are currently at technology readiness level 6, so they're ready to go into the market. Somebody can actually license them. So we're looking at licensing and commercialization of these assays. The second thing that we're doing is really around establishing an OIE, or WOA, accredited reference laboratory for aquaculture disease diagnostics, looking at TILV, ISKNV, and then obviously other pathogens that are relevant to the local industry and to our neighbors and partners across the African continent, and developing novel therapeutics. So again, TILV and ISKNV, major problems, and there's limited treatment options or management options available for these two viruses. And CSR, again, as a technology development agency, we are looking at developing novel technologies and therapeutics for these particular viruses. So again, in terms of the TILV and ISKNV diagnostics, phase 1 of our program is really from 2020 to current, and we've developed conventional real-time PCRs on the right. You can see real-time PCR diagnostics for tilapia lake virus. And then this is just a couple of assays that we developed for detection of ISKNV. And we've completed field trials of these diagnostic kits in Ghana. We're now moving on to an expanded field trial where we're going to test the technology in 5 countries: Egypt, Brazil, India, Ghana again, and Malawi. And then licensing and commercialization of the diagnostic kits will happen early next year. So for TILV, we have 2 real-time PCR assays, one CyberGreen, one TACMan. Again, if you work in diagnostics, you know that there's a variety of instruments, and not all labs have the same access to the same instrumentation. So there's challenges. So one lab may have a machine that can do TaqMan PCR, another one may only be able to do cyber-green chemistry. So by developing diagnostics that can run on both platforms, we have a broader access to market. In terms of sensitivity and specificity, these assays can detect down to about 1 to 10 copies of the viral genome, so they're highly sensitive. And again, they're highly specific. So our assays for TILV and ISKNV only detect TILV and ISKNV, no other related viruses, because of the way that we've designed the assays. The next phase of the program is really around developing, again, expanding that diagnostics and health program. So phase one was just around developing the conventional diagnostics, PCR and real-time PCR, because that was the immediate need, and then commercialization of those technologies. Phase two is really around how do we expand our program to support the local industry, local and regional industry. And one of the technologies that we are developing at CSR is a lab-on-chip platform. So I don't know, where's Neil? I think he left. But to farmers, this is going to be an important technology. So I think even Gillian mentioned that one of the challenges around these current diagnostics is that it takes days to weeks before you actually get a result. And we are developing lab-on-chip, so microfluidics technology incorporating isothermal amplification that's field-friendly, so a portable device that will fit in the palm of your hand, almost literally, and enable point-of-care diagnostics for a variety of diseases. So it's a One Health platform, so we can adapt a platform for human health, animal health, environmental health. And one of the aspects is really around adapting this lab-on-chip technology for ISKNV and TILV, and then also other veterinary or aquaculture-related pathogens. And then phase three of CSR's program is really around diagnostics and expanding that diagnostics and therapeutics capability. And this is where the establishment of a WAVMA reference laboratory for aquaculture disease diagnostics for Africa at CSR. And if you look at this map here, you'll see that OIE or WAVMA reference labs are highly concentrated in America, Europe, and some of the other Asian subcontinent, Australia. But in Africa, we have very, very few. And in Southern Africa, we have less than 5 to 10 reference labs. So, and again, for aquaculture, I don't think so there's any reference lab available for aquaculture disease diagnostics, particularly around tilapia lake virus and ISKNV. And what this lab aims to do then is enable the market to prove freedom from disease. And that will then obviously result in greater exports and broader market access. And then also address biosafety and biosecurity for the country. Having these technologies and these capabilities enables us to do diagnostics and support the local industry. And in that regard, we're supporting the ARC, DEF, I don't see Kevin here, but we're supporting them as well in terms of TILV and ISKNV diagnostics, and then further development of the point-of-care diagnostics around the lab-on-chip platform. And then obviously we can't do this alone, so we collaborate locally with other government institutions and then also internationally, like CFS. I didn't see you at the One Food workshop, but we'll chat. Yeah, so it's really around establishing and looking and engaging with industry so that we can actually support industry and other government institutions so that we can support the aquaculture industry in a much more realistic and achievable manner. And then lastly is really around development of the mRNA vaccines and therapeutics program. And I think just want to highlight this particular paper I came across recently, mRNA vaccination, a way forward for aquaculture vaccine development. And this is in 2018. So this is before COVID. So people were talking already about development of mRNA vaccines for the aquaculture industry, and COVID has just amplified that. So this technology is very, very, very useful for the aquaculture industry, and I think we will have good success in that particular regard. And obviously the CSR's mRNA vaccine program is a veterinary mRNA vaccine program. So for veterinary diseases such as rift, lumpy skin, FMD possibly at a later stage, and then also supporting the aquaculture industry in terms of TILV and ISKNV, and is closely aligned with South Africa's national mRNA technology transfer and innovation hub. So that's, in summary, this is where we are. We're expanding our diagnostics program. So this started as a single research project around developing diagnostics for TILV and ISKNV, and has now been expanded into a much broader program focusing on diagnostics and health. So the commercialization of the ISKNV and TILV diagnostics, that's for next year, and then establishing the lab, as I mentioned, and then the mRNA vaccines program. Really, what this is about, the ultimate aim is really to have better disease diagnostics and surveillance, reduce burden of disease, and then improve access to markets by proving freedom from disease, and then improve biosafety and security. So we now have tools to monitor and have surveillance programs, for example, ISKNV and TILV, that previously we didn't have. Yeah, and that's it from me. Thank you.
Any questions?
I'm glad to see there's so many, but
Thank you. I just want to know, how effective is those vaccines?
So the mRNA vaccines, highly effective, highly effective. So I think, and COVID has shown us really the effectiveness of these vaccines. One, maybe just to, so there's effectiveness in terms of efficacy. So they're highly efficacious. They're highly immunogenic. So that's there. But the advantage of mRNA vaccines over conventional, or over some of the other conventional vaccines technologies, is really around speed. So you could produce a vaccine, in theory, within 6 to 12 months, compared to 5 to 10 to 15 years for some of the conventional diagnostic vaccine technology. So CSR, we have a plant-produced vaccines platform, and we have some vaccines that have been in development. For example, our African horse sickness and vaccine has been in development for about 10 years. And that's really because of the challenges associated with that particular virus, but also the technology itself. On an mRNA platform, you can do that same development in 6 months. So we're starting, for example, we're starting work now on our lumpy skin and Rift Valley vaccines. By March, April next year, we should have a prototype or proof of concept vaccine ready for a cell culture trial or a small animal trial. And that's 4 months. So, yeah.
Okay, thank you very much. Just 2 quick ones. Did you say that you're making trials right now for the kit which you developed, for the diagnostic kit? And when do you think that will come out?
In terms of answering that particular question, the technology is ready. So we are looking at finding a commercialization and commercialization partner currently. But what we found is we wanted to do an expanded field trial. And the reason behind that, we want to develop a better socioeconomic model or business model for that particular diagnostic in terms of how, so if, for example, we know Egypt has a major problem with TILV and ISKNV, but they don't know CSR technology. So we need to take the technology and show them that it works in their market. So that's part, and that, obviously, that economic data will help a commercialization partner to sell the product in the target country. As I'm just using Egypt, but I mean you could use any other country that where these are problematic. So I hope that answers the question.
Okay, we'll start to talk more.
Thank you. I'll be back.
Thank you, Doc. It's of special interest for me to know that you're also doing the trials in Malawi for TILV and the other one. So do you mind just sharing with me where exactly, and maybe who are the collaborators in the country?
Sure. So in terms of Malawi, we were collaborating with Prof. Rwanda, and we're still going to continue collaborating with him at Rwanda University. From Malawi. So obviously, when we developed the diagnostic assays for TILV and ISKNV, we were actually approached by Outer NEPAD to develop the assays. And through Outer NEPAD, we will establish links for field trials, further field trials of the technology. But Malawi has been there from phase 1. So initially we were supposed to do the field trials in Malawi, but due to COVID travel restrictions, we had to change to Ghana. So I hope that answers, but we'll definitely go further.
Thanks very much. I think I'll talk to my colleague, Dr. Njunga. I attended the meetings once at the beginning during your first phase when Eric was there, but now I no longer follow it. I think along the way, maybe with the COVID, I got lost. Yeah, but it's interesting. I think we can talk more later. I just wanted to understand in terms of establishment of a reference lab, and maybe it's just a general question to you and the audience. How does a lab start this process for you to be recognized and the results to be acceptable worldwide or maybe even within Africa?
Yeah, I think that's a little bit of a complicated question. Maybe we don't have much time to discuss. But I think CFAS, so CSR has established a very good working relationship with CFAS. We recently hosted a One Food workshop a few weeks back. And CFAS has quite a few reference laboratories at their facilities in the UK. And it's through that partnership that we hope to get help and assistance in terms of establishing our reference lab and doing the cross-validations and all of that there that will be required for OIE or for recognition. Yeah, so it's a partnership. I don't think so you can do it alone. Maybe that's a simple answer. Yeah.
We have one more question.
No problem.
Hi, good afternoon, everyone. And I think, I don't know if I may jump into your, after the session or after the meeting. So from my side, I want just to know, because you did mention the efficacy of the vaccine, mentioning the COVID-19 vaccine as well. So my question is, do you also look into the frequency of administration of the vaccine as a booster, as part of the efficacy of the vaccine? Because it has been quite controversial. I've read quite a number of publications as well, especially about the COVID-19, and you could see that they were already recommending a booster after 6 months, after 42 days, after, so at which point because I know, for example, the schedule for lumpy skin disease vaccine, Rift Valley vaccine, and so on. Others is on a yearly basis, or after 2 years. But now, in terms of this particular one, how do you determine the efficacy of the vaccine when they recommend, the booster to be given in such short period of time? That's my question. Thank you.
So I think that's an important question, but there's another question that needs to be asked in relation to that question is, why do we have a booster in the first place? And the booster for COVID-19 is in relation to the variants. So you have alpha, beta, gamma, delta, omicron, and so many of them now. And many of the mutants, delta has been shown to escape vaccination. So there's mutations in the spike protein that enables the virus to actually overcome the immunogenicity that is conferred by the vaccine. So basically that particular strain is able to, even if you are vaccinated, you can still get infected with that particular strain. And that's because of the high rate of mutation of SARS-CoV-2. But with some of the other vaccines, especially on the veterinary vaccine side that we are looking at, we don't know yet how quickly these viruses mutate. Some of the viruses, we do have some information, but I think like TILV and ISKNV, we don't really have very, very good data as to how often they mutate. And obviously that's going to be an important study to determine in wildlife or in aquatic environment how frequently these viruses mutate, and then you can look at determining the efficacy of the vaccine. So I think that's an important thing that still needs to be done. Yeah, I hope that answers it.
Thank you very much. We're going to let you go now.
Thank you.
Otherwise you could be here all afternoon. Our next speaker is Dr. Tammy Nokwebela. She's going to speak on the development of indicator cells for virus detection. So Dr. Tammy was born in the Eastern Cape. For 8 years she worked as a teacher in the Eastern Cape, KZN, and in the Cape Town, and she went on to do veterinary studies and has been working as a state veterinarian in KwaZulu-Natal for 22 years. In 2014, she was sent to Colorado, USA, to do a 2-week course in international veterinary epidemiology, and she graduated with her master's in One Health and veterinary aquaculture in 2018. She presently is the chairperson for the National Brucellosis Working Group. Welcome, Dr. Tammy.
My presentation is on the development of indicator cells for virus detection. The virus cell, on virus detection. Virus cell culture involves the infection of a cell monolayer, examining the monolayer on a daily basis and looking for characteristic CPE for the particular pathogen as cytopathological effects. This is the monocell layer that is to be infected, and the virus is introduced into the media, and the result is the production of the cytopathological effects, if there are to be any, and those cytopathological effects will be characteristic of the attacking virus. Cell lines suitable for fish viruses, very few are available, very difficult to match the cell line and the virus. The morphological changes may not be observed. How do we simplify? Cells glowing when virus replicates. Telos fish innate antiviral defense is dependent on the interferon production as the first line of defense system against viral agents. The interferon signal transduction is done by infecting the cell with a virus, and the interferon receptor cells are activated, JAK and start phosphorylation signal pathway activated, resulting in the transcription of interferon simulated genes, of which MX is one of them. MX is one of them. Simplification of virus detection, cell line development. The MX promoter controlled expression of the luciferase gene. So we have a cell line, then we put in MX promoter controlled expression of luciferase genes, and the multiplying viruses induce a glow. So this is MX, and into the cell with a firefly luciferase, and a glow is produced. Now the glow is no longer produced. Methods. The MX promoter control luciferase expression EPC cells is achieved through the propagation of plasmid PGL3 from MX1, courtesy of Dr. Bertrand, testing the G418 susceptibility of EPC cells, optimized transfection of EPC cells with fusion, and a stable transfection of EPC cells. This is the plasmid that we got from Dr. Bertrand, this one. This. The results of the plasmid propagation, we did a transformation in competent E. coli cells. We did plasmid preparation, nanodrop, where we saw that the rating was 737.955. Restriction analysis, agarose electrophoresis, the restriction in PVU2 and SAL1 gave us the expected results, the results that we expected on that plasmid. The testing of G418 susceptibility of EPC cells was done with the G418 at different concentration of 200 microgram per mil, 300 microgram per mil, 400, and then a control plate. The control plate we didn't put the J418. Then we took the reading at different days. On day 1, all the plates looked the same. On day 2, there was less than 65% subconfluent and more than 45% dead cells floating at 200 micrograms. At 300 and 400, there was less than 50% subconfluent and more than 50% of the cells, more than 60% of the cells dead. And this was a control plate. And at day 3, the 200 has got less than 40 to 50% cells confluent and more than 60% cells floating. In all the others, the cells were less than 20% subconfluent and more than 80% floating. And at day 5, all the cells were dead, except the 200 micrograms per mil and the control plate. This is the testing of the susceptibility of EPC cells. This is the 60 to 80 day 1 subconfluent cells. This is the less than 50% day 3 of subconfluent cells, with most of the cells dead. Now we did we optimized the transfection of EPC cells. We did a poly-IC stimulation after 24 hours, and we took a readout after 18 hours. This is the chemolucence that we're expecting to observe, and this is the DNA input concentration, which is fusion to plasmid DNA ratio of 2.5:1. This one, which is black, 3:1, this one, which is greenish, and 3.5:1, which is the darker version of it. And at our reading, we found that the 200 nanograms at 2.5, at a ratio of 2.5:1, produced the best chemolucence. This is the stable transfection of PGL from MX1 into EPC cells. This is a controlled plate, this one. And this is the transfected EP cells at day 10 at high magnification. Both of them are at 10 times high magnification. This we thought are where the transfected cells are starting to attach to the plate. We thought this was the attachment to the plate at day 20 of the transfected cells, and we thought this was the attachment onto the plate at day 27 at high magnification of the transfected cells. The plasmid PGL3 POM MX1 was successfully propagated. This is the discussion. The G418 susceptibility of EP cells was determined at 200 micrograms per mil. Transfection was optimized at 200 nanograms DNA and a fusion DNA ratio of 2.5:1. A stable transfection resulted in floating cells that have not yet attached after 6 weeks. G418 concentration has been dropped to 100 micrograms per mil in 4 weeks, and the cells are being monitored for attachment. If successful, the cell line will be a new diagnostics tool for viral diseases of cold-blooded vertebrates. Fish farmers and health practitioners will benefit from a quick and reliable diagnosis. The cell line will optimize virus identification, possibly a reliable response to viral disease outbreak. I thank you. This was supposed to be a pilot project for a PhD student who was going to start in 2019. I thank you.
Thank you very much, Dr. Tammy. The next presentation is also going to be a recording. So Laura Erdes. Laura is currently a counsellor in European Affairs in the Ministry of Research, Innovation and Digitalization in Romania at the Policy Support Facility Unit. She is a WAVMA certified veterinarian, WAVMA fellow and chair of the Fellow Advisory Council. She has over 20 years of teaching, mentorship and research experience in life sciences and expertise in research design, project management and coordination in research. Her current responsibilities are related to the operational and general functions of the PSF unit and implementation of the recommended measures for the National Resilience and Recovery Plan. Laura will be speaking on applying One Health to aquatic ecosystems.
Hello all, this is Laura Urdes speaking from Bucharest, Romania. I hope you're enjoying the event and you have a fruitful meeting. I am a WAVMA fellow, currently working at the Ministry of Research, Innovation and Digitalization in Bucharest. Also a national contact point for the third EU mission, Restore Our Ocean and Waters by 2030. And we will be discussing about how to apply One Health to aquatic ecosystems. Just briefly introducing this particular EU mission, Restore Our Ocean and Water, and then delving into the One Health concept and how they connect with these aquatic ecosystems. One Health is an integrated approach aiming to balance and optimize the health of people, animals, and environment. This concept recognizes the health of humans, animals, plants, and the wider environment as being interdependent. The approach should mobilize multiple sectors, disciplines, and communities, varying levels of society that should work together to foster the well-being and to tackle the threats to health and ecosystems. This concept addresses the collective need for clean water, energy and air, for safe and nutritious food. It also tackles the need to take action on climate change, and it contributes to sustainable development globally. The Starfish mission is a report that has been put together by the Directorate General for Research and Innovation of the European Union that has as its aim zero pollution, regeneration of habitats, decarbonization, increasing knowledge and ocean literate society, and strengthening the governance. These all are put together for sustaining the third EU mission, Regenerate Our Ocean and Waters by 2030. Beyond this particular mission, there is the European Green Deal, that is a plan that the European Union is taking a lead to implement towards achieving the Climate Pact, and having in mind that no one should be left behind. The objective is to transform the economy within the EU for a sustainable future through research and innovation. There are specific objectives for achieving this pact, and there are a number of programs that are financed through research and innovation to ensure this transition. The mission connects with the Sustainable Development Goals of the United Nations. Several of them are closely linked to the mission and vice versa. More closer, it is linked to the life below water, CDG 14, climate action, CDG 13, and clean waters and sanitation, CDG 6. The mission has 3 objectives and a number of targets, and there are also 2 enablers, amongst which there is the public mobilization and engagement, citizen science, as it is known. The objectives are referring to protection and restoration of ecosystems and the biodiversity of these ecosystems, prevention and elimination of pollution of waters, and making the blue economy carbon neutral and circular. Well, One Health is a concept that has been developed through from the health concept, although it is not currently accepted the definition as one definition to cover all needs. There is accepted that this is an integrative approach to health, emphasizing commonalities of human, animal, plant, and environmental health. It's also accepted the fact that it requires a number of disciplines to work together in several levels of action, and different sectors to collaborate in order to implement this concepts in practice. There is this nice graph that has been developed by the One Health Sweden in cooperation with the One Health Initiative Autonomous Pro Bono in 2015. And these teams saw the One Health as an umbrella delimited by several disciplines, some of them belonging to more to the veterinary science, whereas the others are belonging to human science, underneath which there are in green these 3 levels of action: individual, population, and ecosystem health. One Health has been seen sometimes as equivalent to comparative medicine or translational medicine. It's to zoonotic diseases, but these authors, and currently it is known that One Health is much more than that. It's wider than the proposed definitions that are just depicted here. In terms of the levels of action, One Health refers to individual, population, and ecosystem level of health. At the individual level, it is shown the animal health and human health. Animal health and human health individually are discussing more about the ethical and philosophical aspects of health, such as the mental health, well-being of animals and humans, whereas the population level of health relates more to zoonotic diseases and how they are transmitted and maintained between populations. Ecosystem level of health relates more to the environmental component of One Health, that with those components that ensure allow for transmission and maintenance of these pathogenic agents, including or not only zoonotic agents. Related to the transmission and emergence of zoonotic diseases, There has been an initiative that has been crystallized in last year through the organization of an expert panel that came together to launch a new One Health high-level expert panel from different international organizations aimed at improving the knowledge, the understanding of how diseases with the potential to trigger pandemics emerge and spread. This panel advises four international organizations: the United Nations Environment Program of the United Nations, the World Health Organization, the World Organization for Animal Health, and the Food and Agriculture Organization. So this panel advises the four organizations on the development of long-term plan for action to avert outbreaks such as H5N1 avian influenza and potentially COVID-19. The panel operates under the One Health approach, having in mind the fact that 3/4 of all emerging infectious diseases originate in animals. Well, this has been the introduction on One Health. Now let's see how wetlands, aquatic ecosystems, are positioning within this One Health concept. And in order to increase the understanding, I split the wetlands in two. We'll be discussing first just briefly about aquatic animals as pertaining to this wetland, and then about these aquatic ecosystems and how they integrate or impact on One Health. Aquatic animals, including fish, live in this environment, aquatic ecosystems. They depend on certain physical-chemical parameters of these systems, and then they are influenced by these parameters, such as dissolved oxygen content, turbidity, existing of pesticides, microplastics, and other toxic products, for example, and any fluctuations of the normal physiochemical parameters often cause different state of disease, stress in fish, and obviously they would be able to transmit to contribute to disease outbreaks transmission. Therefore, it is important to monitor and control such life systems. Some of the actions that are being put in place in this respect are proper feeding and handling of these animals, water quality regulations, maintaining species ratio and stocking density, eradication of predatory and nuisance, as well as by selection of quality and healthy seed for stocking. Well, aquatic ecosystems are oceans, rivers, lakes, waters, in other words, that are houses for animals and plants. And these aquatic ecosystems may sometimes pose hazards and risks to those inhabitants as well as to the wider environment, including in this aspect also humans. So there is always a risk of transmission through water of specific hazard or let's call them pathogens through various means in different organisms that live in the water as well as on the land. And some of these hazards are come from suspended solids, dissolved nutrients that emerge from the effluent. The way to tackle these is to increase the byproducts in land-based aquaculture systems, to remove continuously these byproducts, to decrease the environmental impact of such product through better, improved farm management of these systems. An example of this, the way these hazards may result in the environment and pose risks to other components of the environment, including water and land, are aquaculture wastewater that are provisioned with treatment systems in order to prevent these risks to go farther, to spread diseases through. Well, the One Health has been shown as being one of the only component that ensures health of all three counterparts of health: animal, human, and environment. And one of the components, levels of health, which is the individual level, relates to welfare, well-being of animals as well as humans. So they are interconnected. One health, one welfare should be seen as interconnected, as and they lead to actually the concept of one welfare, one health, one welfare. Whereas the One Health includes more than the one the welfare. The One Welfare is a wider extension of One Health. It's important to take care of animal welfare and implement standards that contribute to the reduction of the environmental impact, such that we should achieve the environmental health. This approach of One Health helps improve the understanding of the welfare standards, and it also increases the productivity of animal farming sector. It's important to see connected the animal welfare with One Health, and having in mind at the core these aquatic ecosystems to ensure the food safety, antimicrobial resistance, and to improve animal welfare in farms. And with this nice quote that it is inappropriate to call this planet Earth when clearly it is ocean, I will end this discussion here and wait for your inquiries. Thank you.
Okay, so if there are any questions, if you can please contact Dr. Erdes or through Madeleine. There are no questions and answers now. Next we have, next presenter is Andrew Joseph. He's presenting on the FAO AMR for the FAO AMR Reference Center. And I know, I was just looking at your CV. So Andrew is an early career microbiologist who has developed a specialism in bacterial fish disease and AMR from a One Health perspective. But I'm going to let him embellish on that a little more. Thank you very much. The other mic is there, but it's fine.
All right. Hello. All right. Seasonal greetings, everyone. So my name's Andrew Wakarach Joseph. I've worked with CFAS for 5 years. I'm currently the technical area manager for the bacteriology team, headed by by David Werner Jeffries up there. And can you hear me? Yeah. And I'm also a One Health technical lead for the Ocean Country Partnership Programme, which is a UK aid programme for blue development. But today I'd like to talk to you briefly about AMR in the context of aquatic health, and also give you some insight into some of the capacity building work that we're doing within the AMR Reference Centre. Oh, it's just a clicky thing. So antimicrobial resistance has often been coined as the silent pandemic. And of recent, it has been advocated on many platforms at the highest level. So, for example, the One Health Joint Action Plan on AMR, which was recently published by the Quadripartite, which consists of various UN entities and the World Organization of Animal Health. It has, if you're looking at it from a sort of African context, the African Union has also published a framework document on antimicrobial resistance control, which was, I think, was in 2021. And furthermore, the socio-economic impacts and public health trends have been estimated for the global human population and to some extent the livestock as well. But due to inadequate surveillance systems in aquaculture, little is known about the implications of AMR on aquatic animal health and therefore the sustainable production of seafood on a global scale. There are some publications here that demonstrate actually the trends of AMR actually moving much faster than what was originally reported in the O'Neill report in 2016. It's worth giving a read if you're interested. So when talking about AMR and aquatic animal health, it's very much linked with the environment. So as you may all know, one of the key factors contributing to the emergence and spread of AMR is the inappropriate use in healthcare settings, in both terrestrial and aquatic food animal production systems, and also crop farming. This has a direct impact on the aquatic environment and aquatic animals through poor wastewater management and also runoff from agricultural land. So what you may find is that AMR determinants in other sectors may find their way into aquaculture and therefore have an impact on aquatic animal health. So just to throw a spanner in the works, although widespread AMR has been mostly attributed to the inappropriate use of antibiotics, there has been growing concerns about bacteria's ability to co-select for resistance genes when in the presence of other anthropogenic pollutants such as heavy metals and biocides. So more research needs to be done within this area to really ascertain the contribution it plays towards the emergence of AMR. So, for example, looking at the minimal selective concentrations of the synergistic effects of the minimal selective concentrations of these, what I like to refer to as resistant driving pollutants, may have on the microbiome of aquatic animals, and also the pathobiome and resistome of the environment that they live in. So now a solution to the problem, I guess. So we are the UK FAO Reference Centre for AMR. And as my colleague David said yesterday, we comprise of 3 executive agencies of the UK Department of Environment, Food and Rural Affairs. Together we support the delivery of the FAO Action Plan on AMR 2021 to 2025. and I guess in a global effort to support the strengthening of surveillance systems within agri-aquaculture food production systems, we share we share expertise from CFAS, the Animal and Plant Health Agency, and Veterinary Medicines Directorate. We try to employ a One Health approach to our work, recognizing that the health of humans, animals, and the environment are interlinked. And we try to ensure that each dimension is considered when developing our programs of work. We are currently funded by our parent organisation, DEFRA, but we also receive significant funding from the Fleming Fund, which is a £265 million British aid investment to tackle AMR in lower and middle income countries. David also mentioned yesterday our other designations that we hold as a Centre of Excellence. So, for example, the WAVMA Collaboration Centre for Aquatic Animal Disease. So when we engage with stakeholders in different countries, in lower and middle income countries, we try to have a joined up approach with our other reference centres. So they get quite a good package actually. We're addressing AMR and then also aquatic animal disease at the same time. As a reference centre, our core objective is to support the food and agriculture sector by ensuring dependent livelihoods and economies are made resilient to the impacts of AMR. So our mission is to do this by safeguarding animal and human health, by providing world-leading scientific and policy expertise to address or tackle AMR in terrestrial and aquatic animals and their environment. So our vision is to do this by supporting implementation of national action plans on AMR, and also developing scientific capability and quality management for research and surveillance, and also supporting and advising on governance and formulation of scientific based policy. So we've since we were established in 2019, we've worked across spanning 3 continents in over 10 countries. And some of our capacity building work has been, training scientists in antimicrobial susceptibility tests and diagnostic bacterial diagnostics as well. Enrolling labs on our proficiency test scheme for antimicrobial resistance testing, and also providing expert mentorship to our mentees on our Fleming Fund fellowship program. We also provide labs with consumables and equipment to carry out their work, and enroll them on various other training programs as well, so that they're well equipped to address AMR in the different sectors that they may work in. We have also worked with some European partners to establish epidemiological cutoff values for bacterial pathogens of fish, albeit focusing on cold water diseases. But we would be very interested to work with countries across Africa and also Asia to develop a proficiency test scheme for warm water bacterial pathogens of fish, and also setting epidemiological cutoff values for some of the emerging bacterial pathogens of fish as well. So just sort of narrowing it down to our African engagement. So most of our engagement has been in Nigeria and Ghana, with around 6 fellows mentored to date, and over 132 scientists from the government, private sector and academia trained in various different things such as bioinformatics, as I said, the diagnostics, and also antimicrobial susceptibility testing. We have also worked in the Middle East. We had a collaboration with the Gulf Cooperation Council region, and we were working together to develop a baseline survey for antimicrobial resistance, focusing on the marine coastal environment. And this was using phenotypic and genotypic data to try and map out the resistance profiles along their coastline, looking at bathing water. We were using E. coli as an indicator organism for this. And this was quite an instrumental piece of work that we did, because it demonstrated the use of phenotypic tests and genomic-based approaches for assessing AMR in the marine environment. And I believe this can also this same in the marine environment, and it also I guess validated our proof of concept of establishing a framework, a boundary framework for AMR surveillance. Since then, we've also continued engagement with them through various One Health workshops to help them further develop their national action plan on AMR. I'd like to give acknowledgement to our team from CFAS, the Animal and Plant Health Agency, and the UK's Veterinary Medicines Directorate. And this is just a representation of some of the capacity building work that we've recently done, which consists of lab and field work, workshops, and also engage, a bit of a community outreach to engage with people from all parts of the value chain to discuss about AMR and One Health. Thank you. Any questions?
Just a quick one. When you're doing your work in those countries, do you align your work with the National Action Plan for AMR?
Yeah, so it's very much so based on the country's needs. So what we would do is we would engage with the competent authorities within country and see what elements of their national action plan needs addressing. What you tend to find most of the time is that the aquatic aspects of their national action plans on AMR have kind of taken a backseat because people are more, I guess, interested in the human aspects of addressing the human aspects of their national action plan. But what we try to do is have a sort of a holistic approach to working or helping countries implement their national action plan through our reference centre, but also working with our also human equivalents within the UK government.
Yeah, I'm just following up on that.
Yeah.
Because, for example, in Uganda, we found out that actually, like you say, it was leaning towards the human health. And we found very little on livestock and almost nothing
Yeah.
on aquatic animals. And recently, we're now talking about plants themselves.
Okay.
The plants are also talking about the AMR. So I don't know if that includes any of the other aspects of the two, aquatic animals and plants.
Yeah. So it's very much based on the country's needs. We answer to their request really. You tell us what areas need to be addressed, and we work with you to address those areas.
Any other questions?
Okay. Thank you.
Thank you. Okay, we've caught up time nicely. So. Okay, our next speaker is Eric Boyce-Sawyer, So he's written it in the first person, so I'm going to read it as the third person. He's a paravet with Fisheries Scientific Survey Division of the Fisheries Commission of Ghana, and has been with them for the past 15 years. And he has a master's in philosophy. Is that right? In animal science. With a major in microbiology and immunology, and currently a Fleming Fellow working on antibiotic use surveillance in aquaculture. His interests are on food safety, AMR awareness, aquatic animal health, and laboratory diagnostics. Looking forward to your presentation.
Good afternoon to everybody.
This one might be better.
Hi, good afternoon to all of us. So great to be here after struggling through my journey to get to South Africa. So I'm so delighted to be here. So the introduction has been given already. I'm Eric Sawyer with the Fisheries Commission. So the title of my presentation is Antibiotic Use by Catfish and Tilapia Farmers in two farming regions in Ghana. Excuse me. Okay. So this will be the presentation outline, my intro, methodology, and other. Okay, so currently in Ghana, there's growing demand for freshwater fish. Some reasons being decline in the marine stock, and then now also changing taste and preference for fresh water marine species. So especially the catfish and tilapia, there's more like point and kill. People want to eat fresh catfish. And because of this, there's intensification in production. Our aquaculture sector is booming now. And from research has shown that intensification is leading to aquatic animal pathogen driving AMR or antimicrobial usage. And antimicrobials can be used in the aquaculture settings, but we've known that irresponsible use of it is driving public health concerns due to the impact it has on prevention and treatment of wide range of infectious bacterial diseases. And as a growing commission, we also want to streamline our activities geared towards the National Action Plan on antimicrobial usage and antimicrobial usage and antimicrobial resistance as part of our National Action Plan. So this work also forms as a baseline indicator for us. So the data was taken from August to November 2022, but prior to this we had a pilot project to streamline our work, where we also went through our questionnaires to restructure. So with the current work, we had 34 respondents and 22 from the Greater Accra region, and then we have 12 from Eastern region of Ghana. And the pointer off. So most of the farmers cultivated catfish and tilapia, but it's an ongoing project, so we hope to go to other sites for more data collection. So based on the pilot project that we did, we found out that there was a need for a face-to-face farm visit for data collection. And so we we use a volunteer-based convenience and peer contact sampling method using structured questionnaires. And as part of this data collection, we were able to collect biological samples for bacterial isolation and future antimicrobial sensitivity testing, as well as whole genome sequencing. Okay, so to my results and discussion. So most of my respondents were within the age of 41 to 55 years, and next was 26 to 40 years. And they all had some form of education. In terms of education, most of them had degrees, and most of the farmers were grow out farmers, and all the farmers engaged in this project were all had some previous knowledge in aquaculture. So on the use of antimicrobials, most of the respondents hadn't used antibiotic before, but with those who had used, most of the catfish farmers were using some form of antibiotics, and then followed by the tilapia farmers. And then we also look at the period in which they had used these antibiotics, and we found out that we're within prior to or within the 3 months of data collection, majority of them use these antibiotics. So this is the green graph. It's in just numbers. So we pose some questions to them where they obtain source of information on antimicrobial usage, and we found out that most of the farmers, because they had farmer group platforms, so most of them were getting information on that. I think that this is a spelling issue. It's supposed to be neighbor farmers. Sorry for that, neighbor farmers. And because there were some farms also closer, they were also getting information from colleagues. And then fish suppliers, fingerlings, because people want to be in business. They were also giving their clients some form of information on antibiotic use. We also found out that there's less information from vets and qualified extension officers. Okay, so purpose of using the antibiotics or antimicrobials, majority was to prevent mortality and then prevent illness, and also treat for the disease treatments. And most of the farmers were using this at the blind side of the competent officer. So they were using these things without any recourse to any supervision from any competent officers. And this is very, very dangerous for us. But on this, I must say there's lack of fish health personnel in our department, and currently we are working on it so that farmers could easily approach this most of our officers. In terms of keeping records on the antibiotics that they use, we also found out that most of them never didn't keep so much information on the antimicrobials and or antibiotics that they use. But we could see more information on them, maybe feed, data on feed and other water quality parameters. And then source of antibiotics. So most of them also obtain the antibiotics from the normal human pharmacies, and then followed by agro vet chemical shops, and as well as colleagues. And some of the time, most also we have vets and other extension officers giving them these antibiotics. So with the samples that were collected, yes, with chromogenic culture media, we did some isolation of bacteria, and then used the rapid bacteria identification method as a monitor and some biochemical test to identify. So at the end of so currently, I should say currently, we have 10 bacteria genera where we have isolated 152 bacteria isolates, and they are these are species of them. So the next phase of the work would be antimicrobial sensitivity testing, and then we also do a whole genome sequence to see how related they are. So to my conclusion, so at the end of the work, we expect our findings to be used as a baseline data to feed into the national antimicrobial usage, antibiotic use, and then antibiotic resistance surveillance policy in our country. It should serve as a baseline for us. And then the isolate also could possibly be used as indicator organism for AMR surveillance of aquaculture open water production system in the fresh water environment. From this, I would like to acknowledge some key stakeholders. So first of all goes to the farmers in general, because without them, this work couldn't have been possible. To the Fisheries Commission of Ghana, also, and then the Fleming Fund, Food Safety, that's the Central Veterinary Service of Ghana, and then also CFAS, special thanks to CFAS, staff of CFAS, my mentor, Dr. David, Andrew Joseph, Justin, all the guys at CFAS, and then more donors also as an agent for the Fleming Fund agent in Africa, and in West Africa. Thank you very much. Okay, any questions? Yeah.
I'm going to get my steps in.
Thank you very much, Eric.
Thank you.
We'll need you on that so that the online people can answer. I'll quickly go and change the battery if you are.
This issue of AMR is one thing that I think which all of you will agree will become very controversial, especially in terms of the fish food quality that goes to the consumers. There are a lot of questions that are being asked, especially now there are industries that are using even drugs like formalin and all those. And that also coins to the mycotoxin, toxin contaminations. But we did also some work in Uganda on the AMR, and there was a missing link where we find, of course, they were saying they're not using antimicrobial drugs and all that, but we found some strains, resistant strains against some antibiotics. And then something came up. The small-scale farmers are using a lot of manure, especially from poultry and livestock. And the team, sorry, David, I have to pick on you all the time. That's one thing we need to look at. Is there a correlation or transmission of these resistant strains to these, especially on the small scale, who are using a lot of animal manure? And that also applies to areas that are next to the water systems that are contaminated with human, and I don't know, and we are using a lot of antibiotics. So we might condemn the fish, but we are the ones who are actually transmitting to this resistance to this system. So I think there should be a deliberate effort to look at that transmission pathway and understand exactly where the problem might come out. I just wanted to bring that to your attention.
Okay. Maybe I'll just give a brief. Okay, so pertaining to some farmers using animal droppings or there's poultry manures to fertilize their ponds. Yes, currently with where we did our study, we didn't have that. Yes, but there's been previous study in one of the. Can I go back to my slides, or is that possible? Okay, so there was a previous study that was done in one of the regions in the country where farmers, because they practice integrated aquaculture system. So when you go to the farm, there are other terrestrial animals also, and they. Okay. Okay. Excuse me. I want to use the pointer. Okay, so Ashanti region, from the map, just the white region within the map, there was some work that was done I think 5 years ago, where it was found out that most of the farmers were using or were practicing that kind of integrated type of farming. But within the two regions, the eastern and then the Greater Accra region, where we did our surveillance, we didn't, yeah. And I think there were 1 or 2 farms, but those farms never used anything and their terrestrial animal farms were a little bit away from their farms, the main aquatic farms. Thank you.
Yeah, thank you. I think John has asked, because I also have a student from Tanzania who is looking at the same AMR issues, but looking at manure as one pathway, because these livestock, normally they are fed with a lot of these antibiotics. Then you look at the possibility of them passing it on to the fish when you fertilize your pond with such manure. You may not necessarily be doing integrated agriculture, but you may purchase the manure from another farm and apply it to your ponds and pass on this kind of AMR issues. My other question was to ask the experience for you in Ghana, where you go to a farm, they tell you we don't use antibiotics, then you use the other and the opposite. Have you done that? Or once the farmer says there?
Okay, can I ask? Okay, so with the last question, there's an interesting story. So when we were doing the pilot phase, we found out that when you pose the questions to the farmer, do you use antibiotics? They say no. Okay, now we open up the gate and say, do you use any antimicrobials? It was yes or no. Okay, so we said, okay, we would not go direct to the question. We did a farmer conversation. So it was like, what do you do when you're having mortalities or your animals are not feeding? Then they came up with a conversation. Oh, we do this when we bring. So with most of the tilapia farmers that said they used the antibiotics, and it was during the first 7 days of stocking their pond with fingerlings or whichever stage of growth, because at that stage, really they think the mind is not on the transfer from one state to the other, the stress the fish went through before it could sustain within the new environment. So within the first 7 days, they indicated that they formulate their feed with some antibiotics so that 50-50 the fish might survive. So that was the tricky thing that happened. When you pose the questions to them, it's quite funny. Most of them had some form of education. They know what is antibiotics. When you ask them, they know. Majority know, not all of them, majority know, but when you ask, do you use antibiotics? They say no. So most of our data collection has to be direct farmer visit discussion. and we arrive at these results.
Okay,
Thank
last question.
Thanks. For the sampling, did you consider taking sediments to look at the microbial communities in sediments? Because there's been quite some interesting studies that show, or that rather prove that sediments are like microbial clinics. So when organisms are, hurt in any way, they go into the sediments, and when they feel, did you consider that?
Yes, we did, but with this data collection, most of the water sample, we took water samples, but we really took it some meters away from the banks. So we went a little bit into the middle, but we never took the sediment. But we went a little distance within the ponds. Thank you.
Thank you very much.
Thank you to you all. So grateful.
Our next speaker is Dr. Adeleka Suliat. She is a veterinarian with the Federal Department of Veterinary and Pest Control Services under the Federal Ministry of Agriculture and Rural Development in Nigeria. She is also a beneficiary of the Fleming Fund Fellowship Scheme as a Laboratory Aquaculture Fellow under the mentorship of Center for Environment, Fisheries and Aquaculture Science.
Good afternoon, everyone. I am Adeleke Suliat. I am from Nigeria. I'm a veterinarian working with the Federal Department of Veterinary and Pest Control Services under the Federal Ministry of Agri and Rural Development. I am presently a Fleming Fund Laboratory Aquaculture Fellow. So I'll be doing a short presentation on antimicrobial use and antimicrobial resistance profile of bacteria recovered from fish farms in Oyo State, Nigeria. Thank you. My presentation outline: introduction, methodology, results and discussion, and conclusion. Next slide, please. As we all know, antibiotics are widely used in aquaculture, potentially driving the development of resistance that may pose a threat to human, animal, and the environment. Despite being a major aquaculture producer, Nigeria has limited data on antimicrobial usage and antimicrobial resistance in Nigerian aquaculture. The objective of this study is to quantify and assess the trend of antimicrobial usage in the aquaculture chain, identify and document levels of antimicrobial resistance in the aquaculture value chain and its environment, raise public awareness on antimicrobial stewardship. The aim of this study is also to understand the knowledge, attitudes, and practice of antibiotic usage among fish farmers. Also, to provide better training for farmers on best practices of antimicrobial use to reduce the potential for antimicrobial resistance. Also, to generate data on prevalence of these priority pathogens in respect to antimicrobial resistance. Data collection started from October 2022 to date. Study was done in 4 local governments in Oyo State, Ibadan, Nigeria, which are Ibadan North, Afinjo, Atiba, and Akinyele local governments. 50 fish farms were visited by random selection. 50 LD fish samples were collected, 50 water samples, and 50 structured questionnaires to understand the knowledge, attitude, and understanding of fish farmers in antimicrobial usage. Isolates recovered so far: Aeromonas, Vibrio, and E. coli. Laboratory analysis still ongoing. Okay. So here is my protocol. After sample collection, the water sample and the kidney swab was gotten from the fish samples. So we inoculated the water samples into maconke broth and buffered peptone and deuterium dilution to the power of 3. The kidney swab inoculated into buffered peptone water and alkaline peptone water for suspected Vibrio for the alkaline peptone water. Afterwards, we incubated for 24 hours and subcultured on different agar plates, which is TCBS, XLD, and Aeromonas. Also for kidney swab samples, did the same thing. We subcultured on TCBS, Aeromonas, and XLD. After incubation, we purified suspected colonies for TCBS. Also for XLD, we subcultured on Maconke. For Aeromonas, we did the same thing, purified suspected colonies. Thereafter, we ran biochemical tests, oxidase, catalase, and urase. Pure isolates were subcultured on nutrient agar and sent to Vitec for identification, confirmation, and antimicrobial susceptibility testing. So far, these are the bacteria that has been isolated for the first batch of the samples. We still have other samples to run. So this is just like the first batch of the samples, and analysis is still ongoing. So over time, the results will still be published. Thank you. So we have the results for the parameters used in the questionnaire for understanding the attitude and practices of fish farmers in antimicrobial usage. Age of respondents, we have the highest range of 54% for 41 to 55 years of age. Years of farm operation, we have the highest number for 6 to 9 years, that's 30.2%. The numbers of farmers that had training in aquaculture, we have 83% that had training in aquaculture. Types of farm operation, we have fish only, which is 100%. The correspondence for educational level, we have majorly degree or diploma or HND holders, which is 82.2%. For the type of species produced, we have mainly highest number of catfish for 48.3%. For purpose of antimicrobial use, we have 71.4% of the farmers use antibiotics to treat disease. For the farm capacity, we have small scale for 77.8%. For type of holding facility, we have earthen ponds as the major holding facility, which is 75%. For sludge pond, most of the farmers do not have sludge ponds, so we have 88.2%. For source of antibiotics, most of the antibiotics are gotten from agro or vet shops, which is 89.5%. For use of excreta manure as fertilizer, we have 53.2%, which is never. 48.6% of the farmers have used antibiotics in the last 6 months, and 92.6% admitted that they occasionally use antibiotics. 52% of the farmers do self-recommendation of antibiotics, and also 66.7% of the farmers sometimes keep record of antibiotics used. Knowledge on farm biosecurity. 64.9% of the farmers do not have knowledge on farm biosecurity. Also, 42.3% of the farmers administer antibiotics by themselves. And also, 75% of the farmers are never supervised by competent professionals. In conclusion, from the questionnaire survey, it was deduced that most of the farmers have little or no training on biosecurity measures and they have poor antimicrobial stewardship. My next step, continue identification and antimicrobial susceptibility testing of the remaining isolates using Vitec. I would like to say thank you to the organizers of this program, of this conference, for giving me the platform to present this wonderful work. And also thank you to Fleming Fund and CFAS, which is my host institution, and Mott MacDonald. Thank you, Dr. David, and the rest of CFAS team. Thank you, everyone. Thank you for listening. Thank you, everyone. That is me on the field and in the lab. And also that is me meeting with my mentors and other colleagues. Thank you. Thank you so much for having me. Thank you. Bye.
Dr. Adeleke, apparently you are available for questions. Are you available for questions and answers? Okay, great. Are there any questions for Dr. Adeleke? Hang on. Making me work.
Thank you for the presentation. Mine is just to find out if the study is still ongoing, and is it, would you consider adding a molecular aspect or maybe better metagenomics aspect towards the processing of those samples? Because I think that data would be quite useful for some of us who are looking to maybe provide solutions in terms of vaccine development, but generally also to know what's really happening in those different regions.
Okay. Thank you. Can I go ahead?
That question. Okay, let me get the other microphone. I don't think she heard that.
Yeah, I heard that.
Oh,
Can
you
I
heard it.
answer that?
Okay. Any other questions? Oh, yes, please go ahead and answer it.
Okay, yes, analysis is still ongoing, like I said. So, so far, I've been able to only analyze the first batch of samples from the water sample and the kidney swab. So I'm actually stopping at the point of AST. So maybe my mentor, CFAS, my host institution, maybe they could help with the molecular aspect over time. So, but for now, I'm stopping on antimicrobial susceptibility testing. So isolate may be sent for further testing.
Do you want to answer?
Yes, so what we can do is Celia can submit her isolates to our laboratory, and we can do some whole genome sequencing and some other long read, short and long read sequencing to mine for extensive and multi-drug resistance genes.
Thanks, fellows. You've done a brilliant job. It's been such a pleasure working with both Celia and actually Eric, and Eric's persistence in getting here, and also Celia. I think also it's worth mentioning, actually how brilliant it's been working closely with the fellowship and the Fleming Fellowship Scheme. Anyone who's been engaged in it, please try and get involved. It's just the most marvellous for both the mentors and mentees. I mean, we had met up and thing. But I think another comment is, as part of this sort of outreach and learning, we're hoping to get both of them over to the UK in March. And what would be quite nice for them to work up their isolates and we talk about some of these more advanced approaches. But say thank you, guys. You've done us proud. Thank you.
Yeah, nice outcome from the meeting. Are there any other questions? No? Thank you very much, Dr. Soliat. And now we will break for tea.
Hello everyone, this is Wande Zalalam from Bar.
Breathless. Good afternoon, everyone. I know it's the late shift, but we need to keep going. So, let me just find my space. So, Prudence Ngulula Kayoka Kabongo, is that right? Is a veterinarian. Upon completing her undergraduate veterinary studies in 1988, her interest has been about microorganisms, causing diseases in general, focusing on microorganisms of zoonotic importance. Hence, her research interest areas include microbiology, infectious diseases, and phytomedicine. She also holds a master's degree and a PhD. She has served at different institutions, from the early 90s at the Medical University of South Africa, or Medunsa, as a clinical assistant lecturer, followed by a lecturer in the Department of Tropical Diseases and head of general bacteriology at ARC Onderstepoort Veterinary Institute, technical manager in the pharmaceutical industry, and head of Department of Agriculture and Animal Health. Currently, she is lecturing undergraduate laboratory diagnostics and pharmacology and toxicology modules in the same department at the University of South Africa, while supervising postgraduate students' research. Seeking for alternative solutions to address the rise of antimicrobial resistance in humans and animal production is one of her goals she's pursuing in phytomedicine. Fish farming has been promoted as a source of readily available proteins to address issues related to food security. Like in any other animal production systems, antimicrobial resistance has also been reported in fish production amongst zoonotic fish pathogens. Thank you very much. You've got one there?
Thank you very much for that introduction. Good afternoon. I don't know if everybody...
Might need to hold it closer. It's on, but I think you might need to hold it closer.
Closer?
Yeah.
Like that, okay. I don't know if it's good afternoon everywhere, because we have online audience and then on-site audience. So hello to everyone. For me, it's in the afternoon. When I look at the program, I thought that, oh my gosh, people will be sleepy, they will be tired already, and then how can I keep their eyes, away from stress? Then something that is reported and published is about colors. So if you look at my presentation, the background is blue, and they say that the blue color is peaceful, restful to the eyes, and then also take the stress away. And I hope that my presentation will take the stress away from you. And then you can also see a bit of pink, because they see that the pink color also is restful to the eyes. So I try to combine all those colors so that you guys can wake up. I hope you are awake now. So, so that's just as an introduction to make you awake. So mine, I must congratulate and commend the committee, the organizing committee, the way they've packaged the sessions. Actually, I don't have much to say anymore, because, you have Laura that has touched on One Health, ecosystem, and so on, how the transmission can happen. And then we have Eric, I think, who has touched on antimicrobial resistance. There was also another fellow who has touched on antimicrobial resistance. I think is the gentleman there. So, you have actually touched on everything. So mine will be more shorter, but I will focus on what I am busy with right now. I'm on research leave, and I'm based in phytomedicine. Phytomedicine is at UP, is one of the section in the Department of Clinical Sciences. And then what we do there, when other fellows are seeking for vaccines and other ways of addressing this antimicrobial resistance issue that we have in almost all animal production, we are also focusing on finding alternative solutions by turning towards our natural resources. So our main focus is to look into plants that we do have in the environment, and then we try to extract compound, fractions and test them against some of the bacteria that have shown resistance over the years to try to find out new drugs or new compounds that can be that can replace or that can be used in conjunction with current antibiotics, so that we can find a way of either preventing or treating the conditions that we do find in our animal productions. So, yeah. Like I say, they've touched on everything. What I can say about what justified me to actually focus on the bacterial fish bacteria, I want to read it as it is. I was requested in 2020 to attend a webinar that was organized by our Minister of Agriculture, Toko Didiza. And then the theme that was on the World Food Day, the theme was, I'm going to read it, quoting, grow, nourish, sustain, together our action and our fish. Promoting investment in aquaculture from all sectors can provide a source of inexpensive protein. There I was with my research mind. I say, Prudence, you haven't touched on fish bacteria. So I think this is an opportunity, because when you see the politician coming into the picture, you think about some findings that might be channeled towards that particular field. Hence my interest on fish bacteria. Although I've covered other bacteria as well previously, the same plant that I've selected for this particular research project were used to assess, their activities against a range of Mycobacteria species. And then now we are using the same selected plant to test against the bacteria in fish. So that's more or less what we are doing. And then the issue that we have found in fish, and what I've also read in terms of publications, there are quite a number of publications that are reporting on drug resistancy in fish farming, which personally I was not aware of, because my focus was mainly poultry and other animal species, but not fish per se. So this has given us the opportunity as a team to then focus on the fish bacteria. So we have 3 objectives. This is just the initial part. We have 3 objectives. The project, the research project is still ongoing. And what we always do is first to start testing the reference cultures that are well known, well defined, the American type culture that we are using. We first test against those, and then after that we'll then move to clinical isolate. So those plants have been already identified, as I said, and those are the ones that we are using to look into some virulent factors that these bacteria have been producing. And then I will take you through what we have done so far. So in terms of material and methods, we use bacteria that are considered as model in terms of producing the virulent factors or the factors that the bacteria produce to protect themselves against a hostile environment. And some of those that we did use is Staphylococcus epidermidis. Intermediates did not give good result, but then we use epidermidis. We also are using Chromobacterium violaceum. And then the 4 strain cultures that we are using so far is Aeromonas adrophila, Cytobacter frundi, Edwardsella tarda, and Vibrio parahemolyticus, because we have also realized that they do have, they are zoonotic pathogens that can be transmitted to humans. And as one of the fellow did ask a question about the transmission cycle, one thing about the fish is that the fish do not metabolize the antibiotics fully. So most of the antibiotics that have been administered to fish are excreted in water as they are. So that can also explain the fact that you will find in water bacteria that are resistant to some of those antibiotics that have been used on the farm, but that are not necessarily coming through the manure. So in terms of the method that we have used, so we have used mainly 3 methods. The one method is just to assess if the extract, the plant extract, do have the ability to stop the growth of the bacteria. So we expose the bacteria that are in cell suspension. We expose them to a different concentration of the plant extract, and then we observe the growth of those bacteria, and then we assess, according to some, processes which are published. I want to go into details on that. And then the other one is also to look at the formation of biofilm, because the bacterial cells come together. They come together, stick together to protect themselves against any hostile environment like antibiotics or any temperature environment that is not suitable for their growth. So it's biofilm. That is one of the mechanisms of survival of bacteria. So we also expose the bacteria at time 0 when they've not yet had the ability to form that biofilm. We expose them to different concentration of the plant extract, and then we let them grow, we let them form that biofilm, come together, stick together, and then we expose them to the extract to see if the extract can disrupt that adherence of the bacteria. So we are looking into a plant that can either prevent the formation of the biofilm or disrupt the biofilm. And then we also have another bacteria that we are using as a model. It expresses itself by producing a color, a pigment, a purple pigment, and then we also assess the ability of the plant extract to prevent that communication among the bacteria to express that particular pigment, and we also assess that, and we expose the bacteria to those different concentration of the extract plant, and then we also assess that. That will give us more or less an idea of which plants are more active in terms of disrupting those virulent factors, those mechanisms of protection of the bacteria, and then we can further process the plant in terms of extracting the different fractions and compounds that we will later on again test. So, and then cytotoxicity, of course, that applies to any drug development or any substance that need to be used. One must check and see whether it is safe to use such substance that it won't destroy the cells. So we use, in this particular case, we did focus on using the Vero monkey cells, which are normal kidney cells from African monkeys. Then we expose the cells to different concentration of the plant extract, and then we assess the viability of the cells by working out the lethal dose, that at 50% which concentration of the plant will have destroyed 50% of the cells. And all these are in vitro assays, so we have not yet conducted any in vivo assay. Then, as far as the preliminary results are concerned, I want just to show you the 2 plants that have produced some good results. SMA, as you'll see, I've explained what it means, because the extract were initially, the plant extract were initially obtained from acetone. We did use 2 solvents, acetone and ethanol, to try to allow the water-soluble compound and lipid-soluble compound to be well expressed. Then for the one plant, we extracted with acetone, the other with ethanol. But when we dissolve the extract for the final assays, we use acetone, because acetone over the years has shown that it does not kill the bacteria, and we want to have our control, our positive control and negative control. So we want to make sure that our bacteria indeed is growing in the acetone solution. So The plant that have shown some good result is the Proteus longifolia, and then in terms of inhibiting the growth of the bacteria. So we have some ranges there that have very good activity with both in ethanol and in acetone. And then the plant that have shown a poor result, that is the Sertia machalis montana. In terms of antibiofilm, as I've explained, we expose the plant extract at 0 hour. That is, you do inoculate your culture suspension, and you expose them to the different concentration of the plant, and then you let the bacteria grow over 24 hours of incubation so that they form the biofilm. You know, they have the time to stick together and to protect themselves. Then you expose them to the same concentration of the plant extract. Then you can see which plants can prevent the aggregation of the cells together, and which plant can also disrupt the biofilm that has been already formed. So we have the results there, and then at 0 hour, almost all 4 plants did show a good inhibition of the biofilm, more than 90%. But at 24 hours, we have some a differentiation there, and that is for Aeromonas hydrophila. But then for Hydroxyella, because these are good biofilm forming bacteria, Hydroxyella tarda, at 0 hour we can see that the inhibition was good, so the plant extract could prevent the organism from forming the biofilm. But at 24 hours, once the biofilm has been formed, and then we have exposed the bacteria to the plant extract, there was poor activity there. None of them was even 50%. So from there, we concluded at this particular stage that our best plant to look into, that will be Proteus longifolia. And then we'll also look at the others, that is the Sertia machalis montana, and then we also have Osorata that we'll also look into. But Proteus longifolia definitely is one of our best plant that we'll focus on. And in that regard, we are also seeking for some collaboration, because such work, I think my fellows have also mentioned, that cannot be done in isolation, because we'll need some clinical isolate that we do not have, and then we'll liaise with some of the fellows so that we can have a source of clinical isolate. But for the time being, the work is still ongoing, and I think we'll have enough time to find potential collaborators so that we can carry on with this exciting work. So that's in terms of the future work that need to be done. We are also thinking about testing within the fish environment. We have some ponds around here in South Africa, and fish farming as well, to test the leaf powder as it is and see what would be the result, of course, after testing the water and see what type of microorganisms are in that particular environment. And then we will later on, when we we process the plant further, because that is a biological assay driven process in terms of isolating the pure compound from this plant. We'll also make sure that we do the safety testing of the compound. So I would like to acknowledge my university first for approving this research and then providing funds. University of Pretoria is our partner, a collaborative partner, and then also the Department of Agriculture, Land Reform and Rural Development for granting the Section 20, because I mean, in terms of research, research is not easy anymore, like before, where we could just decide on using any pathogens and carrying on with your research. The authorities are there to make sure that scientists are still behaving ethically, and then it takes months before you can even get the permission to carry on with your research. So I want really to thank them for that. And then I've provided some references for those who want to read further in terms of the method used and so on that will explain in the publications. And then you can indulge virtually, you know, this a nice plate, but healthy fish, as we said, a source of protein and also money, because one must look into fish farming as a source of income. So hopefully that is an area where we'll be also focusing. We can focus on that not only for the local market, but we can also look into the export market. So, and then the end. Thank you.
Thank you very much. Do we have any questions? John doesn't let me down.
I ask so many questions. I'm a farmer.
We'll come to your farm.
So this is a very good approach, looking at sustainable options for against antibiotics. You need also to look probably at the stability of these phytobiotics or phytogenics. I do also the same research back home, and stability is an issue. And then how you're going to deliver this product, in which form, is also another issue. Then the other issue is, you really talked about the biofilms, and I said, okay, that is a real topic these days. Try to look at the biofilms that are attached to these production systems, the aquaponics, and even the cages, because these are reservoirs for co-infection, reinfection. So, and see what will happen with that, the solution you have, the extract. And then I've seen it in many presentations. We are all looking at very simple pathogens, a Romonas, a Dwazella, and even maybe something. But we're forgetting there is also another one which works, the co-infections of Flavobacterium. I advise you also to look at Flavobacterium. That is also another naughty pathogen.
It's on our list.
Very good.
Pseudomonas, Pseudomonas, we have Flavobacterium, we have the other Vibrio alginoticus. So we have a list of bacteria that has been covered. That's why I needed the Section 20. It's quite a long list.
Okay.
But I mean, we're just starting. So
okay.
we have
All right.
Screening first on those that are highly biofilm format, highly, so that once we get, an indication of which plants are the best on those ATCC cultures, because these are not clinical isolates. Oh, sorry. Yeah, these are not clinical isolates.
Okay.
Like I say, these are already well-known bacteria that have been collected and so on that we bought. Then we run this the first screening on them. Then we identify the plant extract that are mostly active. Then we'll go to the next level, where we'll then screen all the other bacteria, because we have like 22 bacteria. We have quite a lot.
Okay.
So,
lastly is also find out levels of
yes.
Since I'm a farmer, when do I expect this?
Okay, farmer, I think we'll come to you. We'll talk.
once you determine the most suitable or the most effective plant extract, do you have any plans to do like efficacy studies using fish, like diseased fish, to see how well it's effective in treating diseased fish?
No, I mean, there's the farmer. I'm going to get in touch with this farmer, you know, and then I think I'll get some of my answers from the farmers that are in the audience. Like I say, I did not focus on fish first.
Yeah.
First, I was focusing on poultry, pigs, and all that. And then when I heard from that webinar, I said, fish, you know. So I've changed my gear toward the fish. Okay. So of course, I've studied the fish aquaculture long ago at school. You know, at vet school, but I did not specialize. I don't know how many specialists are in here in the fish field. Prof, are you specializing in fish? I don't know. Public health. You see, who's specializing in fish? Who's the vet? The vet specializing in fish. Here.
Gillian's in the other room.
It's only Gillian. You see, she's like the only one. She's like the only one.
Francois. Yeah.
Yeah. There are several of them here. Okay, I would like to see them and ask them that question.
I'll point them out to you.
Please.
Any other questions? Thank you very much.
Okay, thank you.
Sorry, I'll be with you in a second. Thought I had it all ready. Sorry for keeping you waiting.
I think we can just skip
Let's skip the CV. Okay. It is a long one. Thank you very much.
Yeah, thanks so much. The last presenter and I were from the same lab, so she's done basically everything about the introduction, so I'm not just going to talk again. Everything has been said. I'm just going to go to my slide. And everything has been said here, and biofilms, like we said, we've been hearing it, food spoilage, diseases in fish, culture systems, and all of that, the effect on One Health, talk about One Health, and all of these things, everything is a problem, and we need to solve it. And like Doctor said, the applications, what do? We know about the microbiology, the molecular stuffs, and all of that. What do we do? And like my colleague said, we're trying to look for alternatives from natural sources, either as extracts, as compounds, natural derived compound, and what can we do? How can we combine them? What can we do to actually solve this problem? I think this is the application we also need to be looking into, not just discovering our antibiotics, which is good, but then we're having issues. So like she's saying, my own study is also looking at compounds. So it's not extract now, but compounds that are of natural origin. So, and I did test for antibacterial activity, and I also looked at the immunomodulatory aspect. Well, everything I did is still in vitro, so we're still going to be doing a lot of work. And I also looked at how the compounds are able to help the immune systems, from fighting infections. So yeah, unfortunately, I also didn't work on Flavobacterium, so sorry for that. So, but the compound that I did test, we actually bought them, not isolated, but they are commercial samples, and they are phenolics and coumarants. So The first thing I did was to look at the biofilm forming capacity. You know, well, like I said, these are still typed samples, not clinical samples. It's formed like a basis for us to do more studies on the biofilm forming capacity of some of the fish pathogens that we have. So I also did the minimum inhibitory concentration test, the anti-biofilm test of the compound against the bacteria that formed good biofilms. And also, of course, like we said, activity can be due to toxicity. So we have to be careful that whatever activity we are saying is not because it's a toxin. So I also did the anti-inflammatory test on macrophages, raw macrophage cell line. I treated them with the compound at different concentration and determined the inhibitory concentration just to look at the ability to help the immune system. So in the study, I did 24 hours and 48 hours biofilm to see how well the pathogens are able to form biofilms. And I found out that, well, this is just the preliminary studies. We're going to study a whole lot of pathogens to determine their biofilm forming capacity. And I found out that hydrocellular tartar, just note that this is the 86C15947. Not all the type strength, so but we still have a lot of work to actually do, and hydrocellular did form the very strong biofilms even at 24 and at 48 hours, and it was the same thing for the vibral with biofilms. So if you're familiar with biofilm studies, you know how we classify biofilms. When the OD of the culture is much more than the 3 times 3 standard deviations above the mean of the negative control, which is just the media, we say it is it has strong activity, and so you can read more on the classifications. So as regards the minimum inhibitory concentration, I found out that caffeic acid had some good activity against 3 of the pathogens, while weak to good activity, you know, across board for the compound. Of course, gentamicin had the antibiotics had very good activity. So yeah, for antibiofilm activity, I just decided to put it on a score so that we can just see. The plus means that it means a very good antibiofilm activity. When it's above 50%, we say it's very good. When it's between more than 1 and 49%, we just classify as good, and anything less than that is actually poor. So as my colleague also noted, for hydrocellular tartar, at 24 hours, most of the compound had poor activity. I would just say syringic acid here had kind of good to average activity across board and across the hours. Gentamicin, of course, also had some good activity, but we could see that here at 24 hours, the compound had very poor ability to eradicate the biofilm, which of course further talks about the issues with biofilms being resistant to antibiotics or to agents that can act against them. So here, well, like we said, we also need to look at the toxicology and to see how toxic the compound are. But I was able to find out that according to our defined parameters, most of the compounds, I can say, have low toxicity. Like we know in toxicology, it's about the dose. You know, nothing is actually safe. It's about the dose. So, but according to our criteria here, most of the compounds had low toxicity, or they were safe. Relatively, please. It's a relative term. Yeah. And for the anti-inflammatory studies, like we said, I worked on raw macrophages, and I grew the cells. I treated them with the compound, and I stimulated the macrophage with lipopolysaccharide for 24 hours, and then I measured the ability of the compound to prevent the formation of nitric oxide, which is a measure of inflammation, and I found the IC50, the inhibitory concentration, and I found out that compared to indomethacin, umbelliferone, if you remember, it's an hydroxycoumaron, had the same activity, the same potency to inhibit the formation of nitric oxide, and different levels of activity, but the umbelliferone showed the best anti-inflammatory activity. So, well, I'm just concluding that most of the pathogens, some of the pathogens formed biofilms. It's just 4, so if we expand our testing samples, we might have a different conclusion, but based on this study, and the compound also had anti-biofilm and anti-inflammatory, anti-biofilm and antibacterial activity, albeit at different levels, as well as anti-inflammatory activity and low toxicity to mammalian cells. So the application, because this is the most important thing, I mean, there have been so many studies on the use of natural products, as antibiotic replacers, in feed added to feed, to fish feed, and also as topical treatment. And so these are some of the areas that we are trying to look at about the application of some of the results that we have. These are still very preliminary studies, preliminary data, and studies are still ongoing, and I hope that in the future we are able to do a lot of in vivo studies and so that we can look at the practical aspects. So thank you very much for your attention.
Thank you. Do we have any questions for the presenter? This side of the room are making you work. Oh, thank you, Kana.
Thanks for the presentation. So I think I have 2 questions. The first one, when you say time 0, what do you mean when you take that point? Is it like a baseline point? Is it at the start of the experiment, and then the more significant result comes out at time 24 hours after?
Okay.
Then,
do you want me to answer that first? Okay, so like my colleague said, so what we did in the assay is to look at 2 different things. The prevention of biofilm formation, how the compound is able to prevent the formation of biofilms. So we just say it's at 0 hour, which means as we had the bacteria to the plate, we also had in the cultures the compound or the extract. So and then we just grow them over 24 hours to see if the sample is able to prevent the formation of biofilms, or by how much is it able to prevent it. So at 24 hours, we grow the biofilms, so they are established biofilms. And then you now treat with your samples, and then you incubate for 24 hours to see if it's able to destroy the biofilm formed. So that's how we say 0 hour and 24 hours.
So what you're saying is that if you started at 0 hours and you went on for 24 hours, there will be no biofilm?
Yeah, so according to the result, the samples were able to prevent the formation of the biofilms.
For 24 hours?
Yeah.
After 24
yes.
hours sample.
Yes.
And the ones that you started, you allowed them to form the biofilm, and then you added.
Yeah, we had it.
So that is what 24-hour result shows.
Yeah, so that actually is like a 48-hour test.
Oh, okay.
Yeah.
All right. Then I think maybe next time you present it, you'll find a better way of presenting it, because the way it shows me is that at 0 hours, you took a sample at that 0 hour time point. And what you're communicating is very critical to understand what happens. Then the other question. Introduce the compound. How did you stimulate your
So yeah, you mean for the anti-inflammatory studies?
Cytotoxicity.
Okay, for the cytotoxic study. So most of my compounds dissolve in water.
Oh, okay.
Or sometimes we dissolve also in acetone or DMSO. So the concentration that we dissolve, that the final concentration of the solvent, let me just say now, is not a toxic concentration, because we also do a separate experiment to also test the effect of the solvent itself. I mean, if it's acetone or DMSO or just water, we also do trials to test that it's not toxic. So which means that at that concentration, is the solvent is not toxic to the cell. So the effects, whatever effect we are seeing of the samples, is not due to the solvent.
Okay. Then the last thing is your data on the anti-inflammatory. That's very good, but in application, you need to think about the need for inflammation to happen, especially if immunity has to be built by the model, the animal that is going to, because inflammation, in as much as we hear anti-inflammatory, inflammation is actually good for an immune response to actually take place. Just
Yes, you're very, very right. I mean, inflammation is supposed to be balanced. You need some inflammation. You just don't want the over-inflammation that will result into issues, So, you're very, very, very right. So what we did was to stimulate the macrophages with LPS, lipopolysaccharide from E. coli. So what it does, in a normal stimulated cell, it increases the ability, the production of nitrite, so which is like an overproduction, like a clean. So we want to see if our sample is able to reduce that. It's not going to eliminate it, but maybe to just control it. So there are other tests we're still doing to follow up these cellular studies at the molecular level. So we're also trying to see the modulation, not really to the kill, but just to modulate the inflammatory event.
John, I'm just checking before I go down. You're going to sit this one out. Any other questions? Okay, I'll be back.
Let me respond before you respond.
Okay.
Yeah, because I think it will address this issue. May I suggest that there will be an invitation? Because most of this stuff happens at our college. So maybe the two of you can meet after the session and get together, because most of the questions that you have are answered by other experiments. And some of those questions can be answered with the two of you sitting down.
Are you still going to ask a question?
For the biofilm, looking at certain pathways to see if there is molecules that are targeting those specific pathways, or explore.
So it's also part of the work we're actually doing now. In fact, some of the work we're actually doing is to look at the molecular level to actually say, biofilms actually, it's actually triggered by certain stressors. Sometimes you see some biofilm genes are expressed under some conditions, and sometimes they are not expressed. So it's not a net, but some of the study we're actually doing is just to look at the effect at the molecular level, which biofilm genes are being switched on and off at certain conditions, So we're even trying to also go into whole genome sequencing to also look at the effect of some of our compounds. So it's just to look at the mechanism of action. So the studies are still ongoing, and maybe we have other platforms to give more results. Thank you.
Thank you. I can see there are going to be in-depth discussions later this afternoon. So our next speaker is John Ford. That's a much better CV than I've got on my piece of paper. So John is an environmental officer, specialized production, sustainable aquaculture management, Department of Environment, Forestry and Fisheries. He is responsible for the development and implementation of food safety programs for cultured marine fish prior to harvest. And these programs include the National Residue Control Program and the South African Shellfish Monitoring and Control Program. And he is currently the chair of the SABS Technical Committee 234 for fisheries and aquaculture products. Is it 234? 234?
Quite a few committees. Great, thank you very much. So the topic is biotoxin risk in shellfish. I'm basically going to cover the vectors for biotoxins in shellfish, talk a bit about the toxins themselves and the risks associated, the risk profiles of these toxins. And then the last slide, which would be more veterinary interest, would be pilot study that I've just concluded for the treatment of abalone with antibiotics to try and reduce toxicity in abalone specifically, which will be hopefully interesting to you. So harmful algal blooms are pose one of the largest risks to shellfish in the industry in South Africa. Certain blooms are toxin producing and result in the poisoning of consumers. The main syndromes are paralytic shellfish poisoning, diuretic shellfish poisoning, and amnesic shellfish poisoning. So paralytic shellfish poisoning is caused by approximately 27 congeners, ranging in toxicity from 1 according to the mouse bioassay, and the 27th one has got low toxicity, saxitoxin being the most toxic congener of the paralytic shellfish toxins. This is an example of Eland's Bay with a bloom, or a harmful algal bloom of Alexandrium. The red color is more by aeration, but Alexandrium is also a coppery color. This particular bloom often causes the crayfish walkouts in Lambert's Bay and Eland's Bay, you might be familiar with, but that's a whole different effect caused by anoxia. But at the same time, the Alexandrium does pose a food safety risk for consumers. Diuretic shellfish poisoning is caused by lipophilic toxins, mostly okadaic acid, yesotoxins, dinophysis toxins, and azaspar acids. The most okadaic acids, and to a lesser extent, the yesotoxins. Amnesic shellfish poisoning is caused by amnesic shellfish toxins, namely the domoic acid. So these are the main species in South Africa that cause these toxins. The Carina cristatus for the neurotoxins, not really a problem in South Africa. The okadaic acid caused by dinophysis, the dinophysis acuta amongst other dinophysis species. And then the protoceration, goniolax, and lingulidium are responsible for other lipophilic toxins. Alexandrium catanella is the main species responsible for paralytic shellfish toxins, and Pseudonetia for amnesic shellfish toxins. Interestingly, though Pseudonetia is very abundant in South Africa, we hardly get amnesic shellfish toxin accumulation in shellfish. We have picked up a little bit in mussels, but not nearly to the proportion of the amount of Pseudonetia present. Right, toxin accumulation and compartmentalization. So mussels, oysters, crustaceans have been known to be susceptible to paralytic shellfish toxins, lipophilic toxins, and amnesic shellfish toxins accumulation. Abalone is more susceptible to paralytic and lipophilic to some extent, but paralytic is a bigger risk. The mode of contamination and compartmentalization of toxin varies depending on the species. So for bivalves, such as mussels and oysters, the toxin accumulates in the viscera as it is filtered out of the water column by the shellfish itself. Crustaceans, and for that reason, certain mollusks that consume other species, they accumulate the toxins by consuming the animals that they feed on, all the plants that they feed on. Abalone, I'm going to touch on the last slide again. Very interesting. It doesn't spire. It's like a land snail. It grasps basically the benthic layer or the algae. So how it actually accumulates the toxins is unclear. We do know if we get a harmful algal bloom of Alexandrium, then there is accumulation. But we've often found as well, even in the absence of a bloom, there's still toxins accumulation in the shellfish, in the abalone specifically. So in the abalone, the toxin is concentrated predominantly in the epiphoidal fringe. We find and the viscera. So once we've eviscerated the abalone, removed the epipodial fringe, the toxin is pretty much removed. You'll notice that the gills also have a fair amount of toxin in them, but the gill proportion to the relative mass of the abalone is very small, so it contributes very little to the abalone itself. So in terms of the actual cause of toxin accumulation, it's important to look at the epiphoidal fringe, as that is where most of the toxin is concentrated, and why. So I'll be touching on that in the last slide. In South Africa, amnesic shellfish toxin is found in low concentrations in bivalves. During 2021, the PST concentrations reached 1.5, 0.4, and 0.8 milligrams in mussels, oysters, and abalone respectively. So looking at the paralytic shellfish toxin, if you look at the abalone and the blue dots, interestingly enough, you'll see that it's fairly uniform throughout the year. It's a fairly low concentration. The regulatory limit is 0.8 milligram per kilogram. So above 0.8, we have to stop harvesting. It becomes toxic to humans. The mussels and oysters, you'll find that the paralytic shellfish toxin tends to accumulate mostly in winter in 2021, which is a bit of an anomaly, because often we find it in spring and late in summer. But this last year was also found in winter, so it's kind of ubiquitous throughout the year. The mussels, interestingly enough, will accumulate more toxins than the oysters, and in monitoring control programs, we use mussels as an indicator for the toxins. The highest accumulation was in June, July. The lipophilic toxins, the concentrations reached was 0.24 and 0.32 milligram per kilogram in oysters and mussels respectively, where the regulatory limit is 0.16. So it's almost double the regulatory limit in mussels and oysters. And that was mostly ochidaic acids, causes diarrhea and vomiting. So the ochidaic acid concentrations in the mussels and oysters, again predominantly in June, but we did find a bit of a spike in December. And again, mussels tend to accumulate the ochidaic acids a lot quicker than the oysters, but in high enough concentrations, you'll find the concentrations similar in both mussels and oysters. The Yesa toxins has been below 0.6 or reached a maximum 6.22 milligram per kilogram, where the regulatory limit in South Africa is 8 milligrams per kilogram based on the Codex Alimentarius recommendation, although the EU regulatory limit is 1 milligram per kilogram. Some countries don't regard it as being toxic. So the Department of Forestry, Fishery and Environment has been implementing the shellfish monitoring program for probably close to 20 years now. And we provide assurances for local markets and for exports for safe products. The paralytic shellfish toxins is tested using LC with a fluorescence detector. The lipophilic toxins are LC-MS, and the amnesic toxins is tested with the HPLC with a UV detector. Since the implementation of the program in 1998, there's been no confirmed cases of human health incidents related to the consumption of cultured fish in South Africa.